Health and Demography Subcommittee on Amendments to Universal Healthcare Act joint with the Committees on Migrant Workers and Finance is hereby called to order. I'd like to acknowledge the physical presence of Senator Rafi Tulfo, and some senators will be joining us a little later as they come. Of course, our chair of the Committee on Health and Demography will also be joining us, Senator Bongo, in a while. Thank you for attending today's hearing. We have 5 bills on our agenda for today's hearing. Number 1, amendments to Universal Healthcare Act, Senate Bills 160, 335, 644, 723, and 770. By this humble representation, Senators Poe, Marcos, De La Rosa, and Angara, respectively. I would like to request our committee secretary to acknowledge our resource persons present for today's hearing.
Thank you, sir. For today's hearing, we would like to acknowledge our distinguished resource persons. From DOH, we have Undersecretary Kenneth Ronquillo. Also from DOH, Dr. Maria Lourdes Gajitos, Miss Anne Julian Genuino Marfori, also from DOH. And then Director Francis Rose Mamaril, also from DOH. From PhilHealth Corporation, we have President Emmanuel Ledesma Jr., Chief Operating Officer Attorney Eli Dino Santos from PhilHealth also. From DBM, our resource person will be Attorney Tennessee Ann Mengulio, and then Attorney Carlos M. Borja, Acting Chief Budget Management Specialist. From the BIR, we have Attorney Anne Lorraine Garcia Marquez. From PAGCOR, we have Maria Cheryl De Guia, Senior Manager, Accounting Department, and Ramon Stephen Villaflor, Vice President, CSRG. From the PCSO, we have Chairman Jeannie Kua, together with Dr. Larry Cedro. We would like also to acknowledge the virtual presence of ASEC Jerome Pampolina from the DMW or Department of Migrant Workers. That's all, sir. Thank you.
Thank you. First, the chair would like to give my opening statement, and after, the chair of the Committee on Migrant Workers, Senator Rafi Tulfo, also probably will give his opening statement. Una sa lahat, magpapasalamat po tayo sa Chairman ng Senate Committee on Health and Demography, Senator Bongo, sa pagkakataong to na mas mapabuti natin ang Universal Healthcare Act. Nakakatuwa pong isipin na fellow health advocate at may malasakit sa kapwa natin ang ating chairperson. Wala pong nakahula sa pagdating ng COVID-19 sa ating mga buhay. Nasubok po ang ating healthcare system, ngunit mabuti na lamang kahit papano ay mayroon tayong UHC noong nananalasa ito sa ating bansa. Pati po ang ating ekonomiya ay napadapa ng pandemya. Napatunayan po na kailangan talaga nating mamuhunan sa kalusugan ng ating mamamayan. Bilang author at principal sponsor ng UHC, nasubaybayan ko po ang pagpapatupad nito noong mga panahon nang wala ako sa Senado. Yun nga lang, no, during the first year of implementation, doon naman tumama ang pandemya. Nung binalakas natin yung sila, masasabi na wala namang kakaiba o ekstraordinaryong pangyayari sa usapin ng kalusugan at ekonomiya. Kaya naipanukala ang pagtataas ng premium contributions upang mas makapagbigay ng mas magandang health services ang ating pamahalaan. Ngunit dahil po sa pandemya, mas marami pong tulong galing sa pamahalaan na kinakailangan ng ating mga kababayan upang malampasan ito. Kung kaya naging pabor po ako suspension ng pagtataas ng premium contribution. We have to adapt to the situation. Mari pong maganda nga ang intensyon ng pagtataas ng singil. Ngunit maunawaan po natin na bumabangon pa lamang mula sa hagupit ng pandemya ang ating mga kababayan. Ang pangunahing pong layunin ng UHC ay mapagaan ang buhay ng bawat Pilipino. Kung kaya nga po, mas naging determinado ako na makabalik sa Senado. Kailangan po natin mas mapaganda pa natin ang UHC at mabantayan ang pagpapatupad nito. Again, the Universal Healthcare Act is a work in progress. Wala po akong sinayang na pagkakataon mula nung ako'y muling mahalal. Katuloy nga po, isa sa aking mga priority legislation ang pag-amenda sa UHC. Particular na sa pagpapababa ng rate ng PhilHealth premium contributions. Layon din po natin na bigyang kaluwagan ang ating mga kababayang overseas Filipino workers or OFWs na sana'y hindi na sila mapigilan sa kanilang paghahanap buhay dahil sa kabiguang makapagbayad ng PhilHealth contribution. Sila man po ay naapektuhan din ng pandemya. Nakatawa po na marami rin ang katulad natin na nakita ng kalagahan ng Universal Healthcare Act. Sa ating pong pagdinig ngayong umaga, tatalakayin natin ang iba't iba pang mga panukalang batas ng ating mga kasamahan na sina Senator Paul Marcos, De La Rosa at Angara. Nagkakasundo po kami na kailangan nating amenda ng UHC upang makasabay ito sa kasalukuyang pangangailangan ng ating mga kababayan. Sana po ay maging mabuong ang ating katalakayan ngayong araw at sa pagtatapos ang ating pagdinig. Naway mas mapaganda natin ang UHC para sa ating mga kababayan. Maraming salamat po. Now, let us hear from the Chair of the Committee on Migrant Workers, Senator Raffy Tulfo.
Maraming salamat, Mr. Chair. Good morning, Mr. Chairman, Senator J.V. Ejercito, and to everyone who are gathered here today. As Chairman of the Committee on Migrant Workers, I'm one with the Committee on Health in pursuing alternative and long-term solutions that will enhance the lives of our migrant workers. Pagsapit po ng Pasko hanggang bagong taon, marami sa ating mga OFWs ang umuwi, magbakasyon at makasama ang kanilang mga pamilya. Subalit hindi lahat sila ay masaya. Marami sa kanila ay dumidiretso pa sa aking programa. Humingi ng tulong dahil bago pa daw makauwi ay ubos na ang kanilang sahod. Bakit? Sabi nila, maliban sa dami ng kapamilyang binubuhay mula asawa, anak, magulang at kapatid, kadalasan na hindi tama ang pagbibigay ng benefits. Meron pa mga dagdag bayarin, kagaya ng contributions sa PhilHealth na hindi naman daw nila napapakinabangan. PhilHealth, meron na bang pakinabang sa ating mga OFWs? To address this issue, nagpatawag po ako ng isang consultative meeting last January 11, 2023 with the Department of Migrant Workers, PhilHealth, and other stakeholders and representatives of Ws. And it has come to my attention the alarming fact that the Universal Healthcare Act, this important piece of legislation, has failed to address their needs. That is why I'm here today to support the proposals for an amendment to the Universal Healthcare Law, one that will address the specific needs of our migrant workers and provide them with the support and protection they require. Thus, I believe that we should exempt migrant workers from the requirement to pay contributions to PhilHealth. As it stands, these workers are paying into a system that does not fully address their healthcare needs due to the nature of their work and their status as overseas workers. This is simply unacceptable, and it is time for us to provide them with a solution that works for them. We have to remember that these workers are the breadwinners of their families, which not only include their wives and children, but most often, they even support their entire clan. Yung halagang 8,700 pesos na annual contribution sa PhilHealth, marahil maliit lang sa nakararami, pero mabigat na talaga yun sa kanila. Tapos, ibibigay pa sa PhilHealth. In light of this, I believe that it is not appropriate to impose further financial burdens on our citizens, including our migrant workers. That is why I'm proposing that we revisit the issue of premium rate increases and work together to find a solution that is both fair and equitable. I'm glad that the President suspended the rate increase for contributions and the income floor remains for this year. Malaking tulong po yun. But this is merely a temporary solution. Socio-economic situation has yet to improve, and like I said, we need urgent solutions that will provide a more permanent effect. With the proposal amendments, agree that the PhilHealth contributions for migrant workers be voluntary, again, voluntary, and empower the Overseas Workers Administration to provide for their healthcare needs. This will ensure that our migrant workers have access to the support and protection they need when they need it most, while also freeing up funds that they can use to support their families and communities back home. In addition, I believe that we must also make use of modern technology and telemedicine to provide medical assistance to our migrant workers, no matter where they are in the world. This will allow them to access quality healthcare services without having to travel long distances or incur significant expenses. And it will be a major step forward in addressing the unique challenges they face. In conclusion, I believe this amendment to the Universal Healthcare Law is a necessary and important step forward for our migrant workers, and I look forward to working with each and every one of you to make it a reality. Maraming salamat po at patuloy po akong sumasaludo sa ating mga OFWs in light of this. I believe that this is not appropriate to impose further financial burdens on our citizens, including our migrant workers. That is why I'm proposing that we revisit the issue of premium rate increase and work together to find solution that is both equitable. Naulit ata to. Sino bang gumawa? In conclusion, I believe that this amendment to the Universal Health Care Law is a necessary and important step toward migrant workers, and I look forward to working with each and every one of you. Maraming salamat po. Tuloy po akong sumasaludo sa ating mga OFWs.
Thank you, Sen. Rafi Tulfo. Anyway, I just like to, as the principal sponsored author of this Universal Healthcare Act, the reason why we have proposed amendments because we will only realize the flaws and the necessary adjustments that needed once it is implemented. Wala naman kasing perfectong batas. Ito'y gawa lang din po natin. So now, this is the reason, and also if I may address OFWs and our workers, that I hope that they would understand that the time that we were drafting and deliberating on this law, what that was 2016, 17 up to 2019 before its passage, wala hong nakapredict magkakaroon ng pandemya. The world's economy, the Philippine economy was good. All of the data, all of the numbers that we used as a reference, kaya nga po sa premium, was based on the circumstances at that time. But because of the pandemic, it's not only the Philippines, it's not only our workers that struggled, it's the whole world. That's why we have to adapt to the situation. And that's the reason why we call this meeting, so that we can hear from DOH, what's the status of the implementation from PhilHealth, will be the effects in case we will have just the premium heights, premium contributions. So we will have, anyway, the bottom line is we want to improve the quality of lives of our people and not be a burden, to give access to good quality healthcare for all Filipinos. But for the information of OFWs, so Sen. Rafi kasi sila po yung naapektuhan, that's why we also want to hear from DMW and not only the OFWs, our local employees, both government and private alike. Just for the record also that all Filipinos are now considered members. So kahit OFW, yung mga naiwan po nila dito, kino-cover po ng PhilHealth, no? Kung magkakasakit. So yan po yung mamaya maririnig po natin. So we will find the imbalance, the win-win situation, kung ano po yung hindi magiging mabigat sa ating contributors na ma-improve naman natin yung serbisyo ng ating mga health services. Anyway, that's the objective of the Universal Healthcare Act. To improve the quality of lives, at least makagaan, no? Yung isa sa pinakamabigat na expenses ng bawat Pilipino, yung pong medical expenses kasi, no? Lalo na sa gamot at iba pa. Anyway, this morning we would like first to hear from DOH, PhilHealth, DBM, DOF, PAGCOR, PCSO regarding the status of the implementation of the Universal Healthcare Act because we are already in the second year of implementation or going to the third year. So what necessary adjustments, ano po ang kulang, ano po saan tayo pwede magdagdag, what necessary adjustments need to be done so that we can fine-tune and make it better. Okay, so the chair would like to ask DOH, Yusek Kenneth, for your presentation and from your statement, probably if you have any presentation as to the current status of the implementation of UHC. Yusek Kenneth.
Thank you very much, Senator, and good morning po, Senator Ejercito and Senator Tulfo, and to the rest of the people here. On behalf of OIC Secretary Bergeret, I'd like to present an overview of Universal Healthcare Act, the progress and accomplishments, as well as the challenges that we have. Can we have the slides, please?
Parang parinig.
Can we have the next slide, please? Yeah. So according to the timeline in the UHC Act, this is represented by boxes as we see. We need to implement managerial and technical integration until 2023. These are the green boxes that you see. Financial integration from this time on, perhaps mid-year of 2023 to 2025, and by 2026, we're supposed to come up with an executive order on the mandatory integration that will be issued. The specific timelines are specified in the purple boxes. The UHC IRR and 60 foundational policies were already issued, and there are still background studies for financial integration that are being conducted until year 2022, and perhaps until this time, the resulting policies should be issued until the end of 2023. The coordinated approach to community health, we call it program towards UHC, aims to implement UHC reforms in an integrated manner in health systems, and this will be implemented from 2023 to 2025, and hoping that at the end we're able to come up with models before the presentation in the independent evaluation body first semester of 2026 in the appropriate executive order. Next slide, please. This is the conceptual framework that we use to assess the attainment of UHC in the Philippines. So the societal outcomes are better and equitable health outcomes, more responsive health systems, and financial risk protection. And this will be attained as we discuss through the 6 building blocks: service delivery, health workforce, health financing, access to quality medicines and health services, leadership, governance, and health information technology, as well as social determinants of health. The main assumption to achieve UHC, or that which has to take place but is not within the DOH's control, is the presence of the whole of government and the whole of society approach. The DOH will aspire, though, to influence as the nation's leader in health to advocate for an environment conducive to the attainment of the UHC. Next slide, please. So we first go to service delivery. This is the desired outcome, that we have a patient-centered care, and it is provided by healthcare providers organized as integrated networks. This means that we have functioning province and citywide health systems that provide accessible, efficient, and quality healthcare services. These province and citywide health services shall adopt primary healthcare approaches that will ensure gatekeeping and continuity of care across health conditions and across all levels of care. And the private sector is part or contributes to the integrated network of these providers. There are sufficient and quality health infrastructure, including telehealth services, and there is a resilient healthcare system with capacity to identify and respond to public health events and emergencies. Currently, we have 93%, the initial 58 UHC integration sites have already achieved the preparatory level for local health systems integration. This is managerial and technical integration. We also have had already 509,207 telemedicine consultations attended under the DOH medicine service program. We have these guidelines issued with DOH, DICT, and Philippine Health Insurance Corporation. Well, there are also 68% functional regional, provincial, and city municipal epidemiology and surveillance units. This is as of December 2022. And more than 144 billion financial support have been provided to health infrastructure through Health Facilities Enhancement Program from 2017 to 2023. So there are 19,821, that's about 43% projects that were completed, while 26,283, that's about 57% projects are ongoing. The total number of funded projects from 2017 to 2023 are 12,921 primary healthcare facilities, 2,285 LGU and DOH hospitals, and 122 other health facilities, as well as 2,298 motor vehicles. Well, our gaps and challenges are as follows. We have to develop the mechanisms for contracting private and mixed healthcare provider networks. We need to strengthen our ICT infrastructure in health facilities. This is weak to no internet connectivity and inadequate and non-serviceable ICT equipment in many of our health facilities. We need trained staff and epidemiologists for our surveillance units to observe optimal staff specialist to population ratio and ensure that HFEP funding to close health facility gaps according to the Philippine Health Facility Development Plan. The next one is on health workforce. So the desired outcome is to have adequate and equitable, distributed, committed, and competent human resources for health. This means adequate number of practice-ready health workers in the health sector, committed healthcare workers retained at all levels of the healthcare system, competent healthcare workers have access to continuing professional development programs, and equitably distributed healthcare workers across the country. So currently, we already have the National Human Resources for Health Master Plan that has been approved by the NEDA Board SDC. As of June 22, we have 39% of our licensed professionals practicing in health facilities in the country. We also have deployed through the National Health Workforce Support System around 25,955 health workers in 1,634 priority areas. This comprises physicians, nurses, midwives, dentists, pharmacists, medical technologists, physical therapists, and nutritionists, dietitians. We have pre-service scholarship programs that has been provided to 451 aspiring health professionals. These are pre-service scholarship programs for doctors, midwives, medical technologists, and pharmacists. In 2022, a total of 6,102 primary care workers were issued provisional certificates in physicians, nurses, and midwives. And in addition, there's an ongoing review and consultation with the Commission on Higher Education to establish the guidelines on the mandatory return service and integration of the scholar into the public health and medical service system for the implementation of the medical scholarship and return service program, both of the DOH and CHED. The challenges that we have for workforce that we need to enhance decent working conditions. Examples of these are providing competitive salaries, benefits and incentives, career development, as well as occupational safety. There's still inequitable HRH distribution in the country, which are partly due to the low compensation and benefits among our health workers' care. And hence, we are urging our legislators to review Republic Act 7305. This is the Magna Carta of Public Health Workers, to provide reasonable incentives to all our healthcare workers, including the private sector, as well as the salary standardization for human resources for health in public and private, national and local health systems. The next one will be on healthcare financing. This means that the desired outcome is to have sustainable, efficient, and equitable healthcare financing to ensure affordability of health services. There is sustained, stable, predictable, equitable financing for UHC, reduced, fragmented, and increased complementation of financing resources to equitably share financial risks. Their strategic and performance-based contracting of population-based health services, strategic purchasing of individual-based health services, and strengthened governance and accountability for financial resources for health. Based on the latest NHA out-of-pocket has improved from 48.6 in 2019 to 41.5 in 2021. However, this remains high with the health spending borne mostly by households. The support value of PhilHealth is only 66%, which means that the social health insurance on average only covers 66 pesos for every 100 pesos healthcare spending on available benefit packages. Our resource here is PhilHealth Annual Report of 2019.
Sorry to cut you,
Yes,
Yusek
sir.
Renet, no? Because this is very important. No? With the passage of UHC, our intent is to lower the out-of-pocket expense of every Filipino and their families. No? Prior to UHC, if, as far as I can remember, during our hearings then, as we were drafting, tama po ba na out-of-pocket expense ng bawat Pilipino? At that time was about more than 50%. What's the 56%? So now it's down to 41.5% as of the moment. Okay, anyway, I just wanted to, because we want to see if the UH is indeed working, because our intent is to lower, kung maging 30% na lang yung out-of-pocket expense natin, better, di ba? So from 56%, it's now down to 41.5% out-of-pocket expense of every Filipino.
Yes, sir.
Okay, please continue.
Well, to continue, there are 346,124 registered Consulta package beneficiaries that were catered by 437 accredited Consulta providers. So this is PhilHealth June 2022. And we're currently collaborating with the Commission on Audit, the DILG, DOF, BTR, and DBM in the development of guidelines for the implementation of the Special Health Fund as a component of universal health care. The challenges and the gaps that we have is that there's a declining share of PhilHealth spending in the total current health expenditure, high spending on pharmaceuticals, low spending for promotive and preventive care services, and this can be addressed by implementing primary care and outpatient drug benefit to stimulate health spending at the primary care level and address majority of the out-of-pocket expenses brought by outpatient medicines. The projected funding gap to implement UHC due to limited physical space given current funding sources and premium subsidies for indirect contributions are not fully provided by the DBM. This can affect the planned expansion of the benefit packages of PhilHealth and the provision of the population-based health services by both the Department of Health and the local government units. We also have limited capacity, both financial and technical, especially of the LGUs, to implement the redevolved health services and the limited number of consulta providers as yet. The next one will be on access to quality medicines and health services. The desired outcome is quality essential medicines, technologies, and health facilities that are accessible for patients and providers. This means access to affordable quality medicines and technologies, strategic and rationalized procurement ensuring availability of medicines and technologies, efficient and streamlined supply chain management system ensuring availability of medicines and technologies, and access to safe and quality healthcare services in all our facilities. Currently, the price of essential medicines for top burden of disease has been reduced by as much as 93% due to the maximum retail price regulation. Affordable access to medicine is an important component of UHC. Measures such as price regulation promotes affordability of medicines to both patients and the government, thereby ensuring the sustainability of the health system. The DOH also recently launch the Health Facility Price Advisory mobile application. This aims to ease and standardize the posting of prices by health facilities to simplify monitoring prices by DOH and PhilHealth and to make price information more accessible to the public. The Price Negotiation Board has been established through the Joint Administrative Order and PhilHealth and DTI. The board will certainly negotiate prices on behalf of the DOH and PhilHealth. And we also have the Warehouse Operations Manual that has been developed to ensure good warehousing practices in all DOH warehouses. And there's an ongoing development of the Electronic Logistics Management Information System, which aims to address the disconnect between the quantification, procurement, warehouse space, and lack of visibility of stock and consumption data from the service delivery points.
And Yusek Kenneth, sorry to cut you short again. Anyway, we all know already these things. Probably what the chair would like to know, the funding gaps na mas importante, because I know that it's a work in progress and the DOH is really working hard to make sure the implementation goes on. Siguro can we hear na lang po from you? What are the budgets that are budgetary requirements for its full implementation at the soonest possible time? Yung funding gaps, that's where we are very interested. So we can also ask DBA, DOF, PAGCOR, PCSO, which are the source of revenue for the funding of UHC para po malaman po natin.
Thank you very much, sir. Sir, may I just discuss the challenges before we
Yes,
go
yes,
to the fund?
please go.
Yeah. Okay. The challenges that we have, these are medicines in the Philippines, especially those that are innovative, are exorbitantly priced when compared to those in neighboring and other OECD countries. Disapproval of the additional funds for the strengthening of regulations and licensing of primary care facilities and additional staff to cover the inspection, monitoring, and surveillance of additional health facilities other than PCF amounting to 95.19 million under regulation of health facilities and services and 211.24 million under regulations for regional health facilities and services. Also, we have the fragmentation in the public procurement system, hence institutions have weak bargaining power to make the final bid price widely varies across different health institutions. The next one on the leadership, governance, and health information technology. So I'll direct my discussion to the challenges and gaps. We have delays in the evidence generation to the lack of efficient research contracting mechanisms to support HPSR implementation, except this year, where the GAA already allows direct transfers to implementing agencies. The lack of dedicated human resources to manage information systems other than ICT services, such as telemedicine, and the DOH's health information technology funding gap. The budget proposal in 2023 was not approved. I think the request here was about 320 million. There's also a mismatch to access versus the number of topics for health technology assessment capacity. The next one will be on the social determinants of health. Again, I'll go directly to our gaps. So while we wanted to implement health impact assessment, as of yet we still have submissions for application for health impact assessment review, especially on the development projects to curb our potential impact on health and contribute toward climate resilience due to the absence of enabling law that will enforce these requirements for development projects. Can we go to the last slide, please? So this is just one slide that provides our budget alignments with UHC, what we have with MTEP requirement, the high scenario, what was approved under the General Appropriations Act, and the funding gap. To sustain these accomplishments and to continuously deliver the implementation of UHC Act, the entire DOH budget, including that of DOH Office of the Secretary, and PhilHealth is always made sure to be aligned with our UHC requirements. For 2023, the total requirement needed to implement the UHC Act based on the latest publication of the medium-term expenditure plan under high scenario is 570 billion pesos. However, only 350 billion is approved in the General Appropriations Act, thus a funding gap of 255 billion. The funding requirement for UHC in the medium term should be realized by the national government so that the DOH and PhilHealth will be able to perform its roles towards the attainment of UHC. The government, particularly the legislators, Department of Finance, the DBM, should explore other options in expanding the fiscal space for health in the Philippines to cover shortfalls such as the earmarking from tax revenues for health, realignment of the overall government budget to priority health programs, incurring managerial foreign debts, and renegotiation with LGUs on their accountabilities as expected in the devolution transition plan. That ends the presentation, Honorable Senator.
Thank you. Anyway, that poses. Can you please go back to the yung slide so we can see the funding gap. I'd just like to ask siguro si Kenneth before we move on to the funding agencies. So medyo malaki no kasi yung nasa law natin and GA nasa 315 billion lang no. It will progress. Simula tayo sa 270 when we first implemented and then it will slowly increase. Bakit lumaki yung yung lalo sa high scenario? Why is it what's the reason for the very high yung requirements of for the funding of or implementation of UAC? Yung pong inyong desired budget. Ang laki kasi do sa funding gap now is now 255 billion.
Well, sir, for this slide, because we only used yung high scenario requirement, but we have also computed for medium term and low scenarios. So that's why mataas ho because we use the high scenarios. But nonetheless, because these are...
Yan yung yung
that's the
high scenario yung sana for proper and kumbaga, yun yung dream implementation nyo.
Yes, sir.
Budget. Kasi just for the record, nung year 1, as I, during our 273 billion, tapos solely 291 billion, year 3, 312 billion. So 2023 is year 5 already, no? So 356 billion. But ang high scenario natin is 570. So sa high scenario yun. Yun lang po yung inyong wish. Kumbaga,
yes, sir. For this
wish,
slide.
Okay. So that means ano po yung mga madidelay sa implementation? Will it cause delays? Ano pa yung mga shortfalls in case kung hindi natin maabot yung high scenario? What programs will be affected?
Sir, the main drivers that we have now is on health facilities, human resources for health. Of course, because we're also espousing on telemedicine, our ICT services. So these are the high cost drivers for the implementation of UHC.
So of course, yung health facilities natin, Health Facilities Enhancement Program, which is already part of UHC. Tuloy-tuloy yun Sen. Rafi, no? Yung every year, we have incorporated the UHC, the improvement of the health facilities. In fact, isa sa mga inan ni Sen. Rafi, yung National Children's Hospital na napuntahan niya, we have increased also from 700 million. We will multi-year natin so that we can yung kasi nakita niyo yung buti na nakita na Sen. Rafi yung state, no, and probably that also happens in our health facilities, but we are also to improve the health facilities para naman sabi na natin hindi naman tayo makakapag-offer ng universal healthcare tapos yung health facilities natin nakatakot. So it continues tuloy-tuloy. So does that constitute the bulk of the expenses, health facilities and our healthcare personnel, no? Healthcare workers, HRH.
HRH. Yes,
HRH. Ilang percent po yung HRH? Ilang personnel do we intend to add for the implementation of UHC?
So looking at SDG requirements in relation to UHC, the recommendation or the reference that we use is 44.5 per 10,000 population. Yung 44.5 po consists of doctors, nurses, and midwives. Hindi pa kasama yung ibang cadres dyan. But at the moment, as we are now, we're at 19 per 10,000.
So malayo pa, no?
Yes, malayo pa, sir. But we have projected through our master plan a 2040 project so that we will meet that. But
So that explains the funding gap and the high scenario for us to be able to catch up with the improvement of health facilities and mapunuan natin yung required health workers by 2020.
2028, sir.
2028.
Administration. Yes, sir.
Because yung ano kasi natin, health facilities sa Sedapi talagang masama, no? Lalo na yung nakita nyo, we're trying to improve para umayos-ayos naman. And we try to thank you for pointing that out. So siguro take note yung NCH na pinayip ni Sen. Rafi, we improve, dapat matutukan po natin. And other health facilities. We added also, no, for the specialty centers, from 2 billion, ginawa natin 6B. So hopefully, we will improve the health facilities very soon. Yung pong ano ni Sen. Rafi kanina, because of our OFWs, yung pong sa telemedicine, can you siguro Yusek, para habang needs si Sen. Rafi kasi he needs to leave by 11:30. Ang concern niya, unahin na muna natin yung tungkol sa OFW, OFWs concerns.
Mr. Chair?
Yes, Sen. Rafi.
Okay, nakalimutan ko lang po sana ito, pero nabanggit niyo po yung National Children's Hospital. And kalunos-lunos nga po yung sitwasyon doon. Yusek Kenneth Ronquillo, sa DOH po kayo. How long have you been working with the DOH?
Sir, more than 2 decades na po.
2 decades, that's 20
Yes.
years. Nakapasyal ho ba kayo sa National Children's Hospital?
Yes, sir.
Sure ka?
Yes, sir, because
When was
as we conduct meetings
When
at the National Children's
Conduct
Hospital.
meetings.
So,
What kind of meetings is it? Saan ka banda doon sa NCH pagpupunta?
Ay,
Saan
sir,
banda ka
but,
doon pupunta?
well, these are meetings of the DOH na nako-conduct po kuminsan sa National Children's Hospital.
Which floor? First, second, third? Anong floor doon? At anong pati doon sa NCH?
Sa office of the director, sir.
Office of the Director. And then
Yes.
after the meeting, ano pong ginagawa ninyo doon?
You
Kasi
mean,
po,
sir, if
I'll make it
the
short now.
hospital po.
I'm going to make it short.
Yes, sir.
Ayon po sa mga taga-NCH, simula po nang itinatag yung NCH, may isang kaluluwa daw po ng taga-DOH, opisyal ng DOH, wala raw pong dumalaw doon para tingnan yung sitwasyon nila. Hindi naman po siguro magsisinungaling yung mga opisyal doon, ano? I don't think that they will lie to me na buti ka pa po napunta rito. Pero ni isang opisyal ng DOH, wala mong pong pumasyal dito para tingnan yung kalunos-lunos na kalagayan namin dito, kalunos-lunos na kalagayan ng mga pasyente rito. Di ho ba? So, 2 decades, sir, I don't know if you're lying or not, but anyway, pumunta man ho kayo doon, lanang inyong DOH secretary, try to visit that facility. Kawa-awa po yun. And then siguro pag nag-visit kayo, doon sir, makikita nyo na talagang yung needs ng ospital na yun ng mga bata nandoon at kung paano po ma-address yung mga pangailangan nila. Okay, sir?
Yes, sir, of course po.
Pangalawa, sir, yung sa telemedicine. Okay, naman nila pinag-usapan ng telemedicine. Marami kasi sa mga OFWs nagreklamo sa akin na bakit kami inuobliga na magbayad ng premium sa PhilHealth. Now, Senator JV sent me with this document, and I think this document comes from you. Tama? Now, this contradicts dun sa mga reklamo ng mga OFWs na hindi rin nila pinapakinabangan. Napapakinabangan yung PhilHealth premium na binabayaran nila. Kasi, example, 2021, 210 million ang totally collected premiums from the OFWs. Tama? And then the claims paid for that particular year was 1.42 billion. So, ibig sabihin, talagang sobra-sobrang pakinabang ng mga OFWs. Am I right? And then same on 2020, 340 million, and the claims paid 1.36 billion. Is this accurate record? And then it goes on and on. Pataas na 2019, 1 million ang nakolekta. Millions to, right? Not billions.
Yes, sir.
1.2 million.
Billion na po.
Sorry, okay. 1.2 billion na. And then 2.7 billion ang claims paid. So lumilitaw na talagang sulit na sulit. Ano po? Mas malaki pa yung nababayan ng claims versus sa premiums collected. So, bakit po ang dami pa rin mga OFWs nagreklamo na wala kaming pakinabang dyan, bayad kami ng bayad, bakit saan yung bayad namin? So, hindi po tumutugma. Maliban na lamang kung ito ay tumutugma doon sa kumalat na mga balita noon na marami sa mga clinics at mga doktor nagpa-file ng mga bogus claims. Ano po sa palagay nyo, Yusek?
Senator Tulfo may defer that to PhilHealth kasi galing po sa PhilHealth.
Probably newly the president of PhilHealth, Manuel Ledesma, can answer. Alam ko kaka-assume nyo lang, but siguro anybody from PhilHealth can answer.
I will answer, Your Honor. Thank you, Your Honor, Your Honors. My answer would be, human nature kasi po, people are always hoping for more. You know? I think generally, regardless of your status in life, very few are really satisfied. No? Palaging sana mas mataas, sana mas marami. No? So I think I will answer your question by looking at the facts. No? And
Okay, so sir, may I interrupt just a minute? Just a second.
yes, sir.
Hoping for more, hindi kontento yung ibang tao. So, ibig mong sabihin, sakim at greedy ang mga OFWs natin? Is that what you mean?
Hindi po. I was saying, Your
Sir,
Honor,
please don't use those words. Nakaka-offend po na hindi kontento. Kasi that's tantamount to saying na people are greedy and sakim in Tagalog.
I
Wrong
apologize.
choice of words, sir.
I apologize for the comment, Your Honor.
Thank you, sir.
What I wanted to highlight, Your Honor, is I feel that I will have to disagree with the OFWs
Okay,
because
you can use that word, pero wag yung hindi makontento. Okay?
yes po.
Kasi if sinabi mo hindi makontento, ang kasunod niyan, ang definition niyan ay sakim.
Yes po.
Kasi yung mga tao hindi makontento, sakim ang tawag doon sa atin sa Tagalog. Ano po? So, in English is greedy. Huwag niyo pong bigyan ng that kind of image yung ating mga OFW especially.
Okay po. Again, my apologies,
Thank you
Your
po,
Honor.
sir. Thank you po.
So I would like to use the chart which your good honor mentioned earlier, Mr. Chair, wherein it clearly shows for the year 2021, the premiums collected was 0.21 or 210 million,
Mhm.
but the claims paid was 1.42 billion.
Okay?
So I think if we just base this on the chart, and this is understanding is a very accurate chart.
Okay?
It shows po that it clearly shows po na nagbe-benefit po yung mga tao
Exactly. So they benefit a lot.
sa claims ng PhilHealth po.
So,
And
did they benefit more versus doon sa kanilang nababayaran premium? Okay, contributions. Okay?
yes po. And I'd like to say much more kasi if you look at
Much more.
yung multiplier, ang laki po. Your
Ano?
Honor. Yes.
Oo nga, no? Okay.
So again po,
Mhm.
and again, sorry for the language, but I feel from our end, from PhilHealth's end, we are doing our part in serving the
Pero siguro, Mr. Ledesma, para maklarify kay Sen. Rafi, yung i-detalye na lang natin, yung claims paid, sino po ang kumukuha nito? Kasi OFW, sabi niya, nandun sila sa labas eh.
Yes.
So ito bang claims paid are members of the family who are still here? I-clarify niya na lang po.
Kasi po lahat ng members ng PhilHealth 100% po, no. So kunyari may nagko-contribute, kung may mga anak, may mga pamilya.
Excuse me, sir. Can you just answer the question of the chair? Sino nagbe-benefit dito sa 1.42? Let's talk. We're talking about the 2021 year na premiums paid by the OFWs 210 million and then 1.42 billion claims paid. Sino po yung nag-benefit doon? Yun po ang tanong ni Mr. Chair. Yun sana ang tanong ko naunahan niya ako. Pakisagot lang po.
Yes po. Yeah.
Sino po yung mga nag-benefit dito sa claims paid?
Po, if I can just be given a few seconds, no? I will give you the breakdown po, no? So, for
Hindi sir pakisagot lang po. Doon sa 1.42 billion na claims paid ng 2021 para sa mga OFWs.
Yeah.
Sino po nag-benefit doon? Mga OFWs ba o
their families po.
or their families?
Yes po. We understand the question po. I'm just getting the exact.
Pakibigay lang po yung percentage, siguro po.
Yes po. I'm just getting the exact figures po. Sorry because I don't have it on top of mind po. No. It's already here po. I just.
You know what, sir? The answer? The possible answer for me? Family. Kasi, hindi mo na tingnan yung records mo. Kasi nga, the OFW will not benefit. The OFW themselves will not benefit because they're out of the country.
Yeah. Yes po.
The right answer doon sana, sir, is the family, the anak, the asawa, etc.
Yeah.
You don't have to look at your records.
Most likely po, I was going to say, sorry, Your Honor. Most likely po, it's the families.
Exactly.
But in line with that po, if I may add po, since the families of the OFWs benefit, I think po it's also tantamount or it's close to the OFW benefiting kasi yung pamilya po nila.
No, sir. No, sir. Again, wrong choice of words. The beneficiary are the members of the family who are here, right?
Yes po.
Doon na naibayad yung claims. Doon sa pagpapacheck up, pagpapagamot ng mga families na dito. Never na makikinabang dito ang mga OFWs. Tama? Because nandun sila Hindi inori yung nandun But if you tell me, meron kayong tinatawag na teleconsult, consult sa telepono ng mga OFW, then pwede pa. Naniningil yung mga doktor doon sa teleconsult ng mga OFWs natin. Meron bang ganung programa ang PhilHealth? OFWs?
Yes po. Just to
Yes, sir. Just answer, yes or no?
yes. Yes po. The OFWs po can also avail the benefits abroad po.
They benefits abroad? How can they do that? How do they benefit?
Okay, if I can explain po,
How can they claim benefits abroad
yes po.
from PhilHealth?
I had just joined PhilHealth. I know for a fact that they can avail. For the details po on how they can avail po, if I can ask my COO attorney.
Please, anybody can answer kasi
Thank you,
we
sir.
understand you just assume.
Yeah.
So anybody from PhilHealth who is more versed dun sa program can answer para maano niyo yung query ni Senator
Thank you, Your Honor.
Attorney Eli Santos.
Mr. Chairperson, good morning. Honorable Senator Rafi Tulfo. Good morning, sir. Sir, if an OFW is confined in a hospital abroad, he or she can claim, that OFW can claim for reimbursement for the hospital expenses here in the Philippines. All that is needed, all that are needed are the documents pertaining to the hospitalization of that OFW, Mr. Chairperson, Honorable Senator Rafi Tulfo.
So, ilan na po sa mga OFWs ang nag-claim ng reimbursement? Do you have those records?
Mr. Chairperson, if I may.
Sige po, at magkano na po yung na-reimburse? Yung ba mga dokumento na yun ay legit? O, tulad na kapapabalita, bogus, may mga claims na bogus na i-file, binabayaran yung mga bogus claims, kaya nga muntik na malugi yung PhilHealth. So, please answer, sir. Attorney, sir.
Honorable Chairperson, Honorable Senator Rafi Tulfo, sir. At present, sir, we do not have the data.
Why not? You came here unprepared. You're a lawyer. You should be prepared.
Yes, sir. But we will submit the required data, the breakdown, sir, of how many of the OFWs submitted their claims for reimbursement here in the Philippines.
I need that record.
Yes, sir. We will provide the data, sir.
Yes, attorney, please provide this committee so we can also provide the Senrafi. Lahat ng nag-reimburse, nag-claim at yung nabayaran.
Yes, sir. We provide that, sir.
I'll tell you this, attorney. Maybe you don't know this.
Yes, sir.
Okay. Pag yung OFW natin nagkasakit doon sa, let's say, sa Saudi, yung amo nila, pinapagamot sila. Pinapa-hospital sila. And then pag uwi ng bahay, okay na sila. Ngayon, sasabihin mo sa akin na this OFW na pinagamot ng kanyang amo, na binayaran ng kanyang amo ng libre, ni-reimburse nyo? Kasi kadalasan ganun po, sir. 99.9% ganun po yung nangyari na yung amo nila ang nagbabayad sa ospital. Amo nila ang nagpapagamot sa kanila ng libre. But there are times na yung amo nila, sinisingil sila. O yung amo nila, pinapabayaan sila. Pero that's only a fraction of the numbers of OFWs na nagkakasakit. Mostly, yung amo nila ang nagpapagamot and then libre. Kaya nga po, kung libre yon, nagpapa-reimburse ba sila sa inyo? And I need those records. And I need to know. At gusto ko makita yung sino pong, kung meron man, gusto makita yung mga pangalan na nagpapa-reimburse at pumipirma para pwede kong isa-isang tawagan at puntahan para masiguro talagang sila ngayon at hindi po bogus yung claims. Attorney, sir.
Mr. Chairperson, Honorable Senator Tulfo, sir, we commit to provide the data, sir, to this committee as soon as possible, sir.
But I would suggest to you, Attorney, yaman din lang, nandito yung PhilHealth. Wala ho ba kayong teleconsult service sa mga OFWs? Dito magkakaroon sila ng pakinabang. Yung bang 24/7, para dun sa mga basic illnesses. Kasi kung minsan, may mga OFWs natin, kahit na trangkaso yun, gusto lang nila may makausap sila para matanggal yung stress at panic nila. Na a doctor on the other line would tell them, ganito po yan, huwag kang mag-alala. Ito lang pong pwede yung inumin ng gamot. And then siguro, makipag-usap kayo sa gobyerno ng host country kung nasa yung ating OFW, na i-honor po yung inyo pong isusulat na reseta or kung ano man yung counterpart doon na medicine sa bansa na yon. Kayo na ba nagagawa ng arrangement? Tama ba ako, PhilHealth? Meron ba tayong teleconsult service?
Mr. Chairperson, Honorable Senator Tulfo, at present, sir, we do not have it. We are planning to do it, sir. We realize the significance and importance of telemedicine during the pandemic, sir.
Then only then magkakaroon ng pakinabang sa inyo ang OFW. Meron yung servisyo na yan. Unless meron yan. Wala yan, walang OFW ang may kinabang. Maliban lang sinasabi ng reimbursement. And then kung meron talaga, then gusto ko makita yung records. Noon.
Mr. Chair.
Yes, please, Mr. Ledesma.
I just want to make a quick comment, Your Honor. Based on the question of Honorable Senator Rafi earlier, we were able to extract the data po for 2021 and the breakdown po are as follows, no? For the members, the payment, the claims amount was 1.181 billion. Now, for the dependents, the claims amount is 526 million. So, to summarize po, mas malaki po yung claims ng member versus the dependents po. So, to repeat po, it's 1.181 billion for the members and roughly 526 million for the dependents.
Wait a minute here. Okay, so ibig mo sabihin, napapakinabangan ng halos lahat ng mga OFWs ang premium nila. Sasabi ko lang po kanina na marami sa ating mga OFWs hindi po nagagamit yung PhilHealth sapagkat yung amo po nila ang nagbabayad sa kanilang papagamot, papadoktor, pagpapahospital. So, titing ko, you mean to say, after mapagamot, ito mga OFWs natin, libre ng kanilang mga amo, sisingilin nila ang PhilHealth, umabot sa 1.181 billion? Sir?
Mr. Chairperson, Honorable Senator Rafi Tulfo. Sir, the data shows in general the reimbursed amount in terms for the dependents and the members.
No, sir. Let's just talk about, sinabi kasi ni Mr. Ledesma na yung claims paid sa member, meaning doon sa OFW na nagbabayad ng premium, ay umabot sa 1.181 billion. Mas malaki pa kaysa doon sa relatives. Pero kung sasabihin nyo mas malaki yung dependents kaysa OFWs, mas kapanipaniwala. This record, mahuba kayo. Yung pagtingin nyo, tingnan nyo ulit. Magsalamin kayo, sir. Kasi kung tama yung sinasabi nyo, then tasang kilay ng mga OFWs natin. Bakit? Umabot sa 1.181 billion yung claims nila. Samantalang, pag ginagamot sila doon sa Saudi, Kuwait, kung saan man lugar na yon, hindi na magpapayad. Libre. Wala pa ako narinig na OFW natin na pagbalik dito sa Pilipinas, sila ay nagkiklaim for reimbursement. I haven't heard of that. I have still to hear about that kind of statement from you, Attorney Santos, sir.
Mr. Chairperson, Honorable Senator Rafi Tulfo, sir. Sir, the data presented earlier by our President and CEO pertains in general to the amount reimbursed to members and dependents. It was for this reason, Mr. Chairperson, Honorable Senator Rafi Tulfo, that we requested that we be given the opportunity to provide this committee the specific data that pertains only to the claims of.
Mr. Chair, sir, hindi ba, Mr. Ledesma, kayo dyan sa PhilHealth, no, you guys are smart. Hindi mo kayo mapupunta dyan o malalagay dyan sa inyong mga posisyon kung hindi kayo smart. Di ba? Kasi meron mga ginagawang betting ang Malacanang, screening for smart people to serve the different departments of our government, right? So, you being smart people, the two of you, it defies logic. What I'm saying is, you know, paying 1.181 billion to OFWs na hindi naman sila hindi naman sila yung nagbabayad ng gamutan, sila yung nasa abroad, kundi yung kanilang amo, and then pagbalik dito, pag-claim pa rin sila. I'm not questioning yung data ninyo. Na talagang, I'm sure meron kayong ganun data. However, I'm questioning the legitimacy of that data that you have. Baka, yan ang po yung napapabalita, yung bang korupsyon, malawakang korupsyon sa PhilHealth, na may mga bogus claims. Ito na nga po siguro yun, na may nag-file ng claims on behalf of these OFWs na hindi naman. Pinipeke yung kanilang pirma, kaya nga, I need those records. Tingnan ko, isa-isa kung kinakailangan. Pagpapulatan ko yan at ng mga staff ko. Kung talagang sila ngayon nag-claim for reimbursement, baka naman hindi sila. Kapag hindi sila, dapat may makulong. Yes, sir. Mr. Ledesma, sir.
Your Honor. Your Honor, thank you very much for the question. We fully understand the point you're driving at in your question. So with all due respect, Mr. Chair, if we could be given some time, what I will do, I will personally submit, we will break down, we will extract in full detail all of the data broken down po para makita niyo po very clearly saan nanggagaling yung full figure po.
With the indulgence of, Mr. Professor, with the indulgence of Senator Rafi, ang concern niya kasi we know for a fact that PhilHealth before, ang mga issues yan, mga bogus claims, yan yung mga nag-uubos ng pondo ng PhilHealth, mga upcasing. So, siguro, what are you planning to do para masiguro lang na yung, baka mamaya daw kasi yung mga claims, baka galing sa mga bogus. What are you do under your leadership? Ano po reforms that are being undertaken by PhilHealth para masigurado that those who are claiming talagang legit. Siguro yun ang concern ni Sen. Rafi. Baka raw kasi yung mga bogus, yung mga dating issues, no? Ano pong ginagawa nyo?
And before you answer that question, Mr. Ledesma, sir, January 11, 2023, dito tayo hindi kayo kasama, consultative meeting, and I already requested for those records. Bakit hindi po dala? Hindi po kayo sinabihan ng inyong mga tauhan na napag-usapan ito at maaaring itatanong ko ulit. So, for the second time, I'm asking you. So, sa sunod nating hearing, baka wala na naman.
Again, thank you for your question, Mr. Honor. Your Honors. First of all, we will comply. We will submit the data as soon as possible, Your Honor. Maybe if you can give us even just a few days, Your Honor. Like I said, I will personally see to it that the data is complete, it's in detail, and it will be submitted to the good committee. No.
Ano po sa question ni...
Yes. To finish first your question, Your Honor, and you're saying last January 11, you requested for that to be submitted. I'd like to apologize in behalf of the group, no, why it was not submitted. But again po, maybe you can be accountable for after a few days we will submit that po. To answer the question,
Thank you, sir. Thank you, sir.
You're welcome, Your Honor. To answer your question, Senator Ejercito, no, we're doing a lot of things, but mainly yung regarding the bogus or the fraudulent claims, no. Even before I joined, I know that was one of the issues that was brought forward to my attention, no. So one of the things we're principally focusing on now is for the full computerization and digitization of PhilHealth. No? A lot of this po kasi, yung pagka-recording, yung delays, a lot of that is really to do medyo backdated po kasi yung sistema namin, no? So it's susceptible to I'm not saying there was fraud or there is connivance and all that, but it's susceptible. So we are prioritizing that, and in fact we have met with both private sector, with government. We've been coordinating very closely with the ICT, Sec Ivan, and we are on the right path po. Again, these things take time, but I can fully promise this good committee that we are addressing it, we are working on it, and we are trying our best to move it forward. No? That's all, Your Honor. Thank you po.
Maganda yung sinasabi mo, i-computerize na yung pong sistema nyo dyan sa PhilHealth, right? Kahit anong klaseng computer ang ilalagay nyo dyan, pero kung yung nag-operate ng computer at yung mga tao dyan, ang mga loko-loko, nandiyan pa rin, tuloy-tuloy pa rin korupsyon, tuloy-tuloy ang ligaya. So if I were you, kailangan nyo pong magwalis. Walisin nyo po yung mga loko-loko dyan. In fact, nakakatawa nga Mr. Chair, panahon ng pandemic ata to, na yung isang sinabing corrupt, ay na-promote. Corrupt na nga, promote. Diba? It's not you, sir. Not you. So, siguro po, maglinis-linis kayo. Linisin niyo po yung PhilHealth. Mag-imbestiga po kayo sino-sino po doon yung involved sa korupsyon. Alisin niyo po yun. Then, maniniwala ko na maging maayos na puntak po ng PhilHealth. Maniniwala kaming lahat. Okay, sir. Thank you, Mr. Ledesma.
Can I comment, Mr. Chair?
Good, sir.
We hear you loud and clear, Senator Tulfo, Your Honor. When I had accepted this position po, actually po I was actually personally handpicked by the President, no, for this position, and I actually promised them that I would do my best to continue moving, continue all the good things that PhilHealth has done, and if ever I find out that there are wrongdoings or shortcomings, we shall definitely address it po, no. I can assure that to this good committee, all I'm asking sana in return from the good senators, and I said the same thing to the good congressmen, no. Sana po bigyan niyo kami ng pagkakataon, no. If the president of the Philippines has a so-called 100-day honeymoon period or 200-day honeymoon period, sana po kami rin. Parang give us this chance, no. We hear you loud and clear. I personally, I don't know if there is all this talk, if it's there, if it's not there, no. I have been actively looking since I had joined, although I'm very new, no. So far po, to be honest, wala po akong nakikita, no. In fact,
Wala po kayo nakikita ng corruption sa PhilHealth? Yung mga previous?
as far as from ganito po, I have joined less than 2 months.
I know, sir, pero
I have
wait a minute. I'm offended. Even the taong bayan are offended. Kung sabihin niyo po, samantalang deklarado na po yan, nag-hearing na yan dito, at marami ng mga ebidensya na papakita na may mga bogus claims na ipa-file ng mga doktor at hospital, and then sabi mo, wala ka pa rin nakikita. Sir?
Mr. Chair, yes. Sir, can I cite an example, no?
Sir, kasi sabi mo, wala pa nakikita. So, you're making stupid out of us. Out of all of us. Kasi, na-media na po yan. Kumalat na po yan. Paulit-ulit na lang yan sa media na mga bogus claims. Meron na nga po mga na-ombudsman, meron na po mga inimbestigahan. And then sabi mo, wala ka pa rin nakikita. So, kinukonta mo po yung mga records na lumabas na with pieces of evidence showing talagang it existed. And yet, now you're saying, wala ka nakita, and then you're asking for a honeymoon period. Of course, I'll give you a honeymoon period. Why am I doing this? In-expose kita Total, wala ka palang nakikita. Now, this is your opportunity na para makita mo, ma-expose ka doon sa mga nangyaring kamalian doon sa PhilHealth para hindi na maulit when you watch. Pero sir, first, dapat tanggapin mo na meron talagang problema sa PhilHealth. Huwag po yung in denial eh. Pala agad, sasabihin mo wala, malinis kami. Then, I'm sorry sir, then you're not good for that position. For you to be able to clean an organization that has been punished with corruption, first you have to accept that there was really corruption. Do not be in denial. And that's the only way na para masolve mo po yung problema. Tanggapin niyo po muna and then saka ko'y maglinis. Hindi yung pwedeng walang nangyaring problema rito. Then wala ka malilinis.
Noted po. What I wanted to say po was this, no? I understand fully, and I'm with you po. If you want to solve a problem, you have to admit first that there is a problem and what is the problem, no? Now, what I'm saying po is, I had just joined PhilHealth and I am thoroughly looking into everything, no? Because again, one of the even before I joined, I did a lot of reading. I talked to a lot of the ex-PCEOs, the ex-PhilHealth, ex and present PhilHealth employees, and I did my own research po, no. Now, what I'm doing now is until there is hard evidence. I'm not a lawyer po, no, but until there is evidence and proof, I don't want to falsely accuse anybody po, no. If I may cite an example po, no.
Sir, meron na po nangyari mga investigasyon. I was expecting you to say na yung mga iniimbestigahan ko. Alright? I will do my own investigation. Yes, meron mga ganun balita na corruption involved. Then, kung sino man mga yun, I will cooperate and I will investigate. Sir, parang pinagtatakpan mo eh. Para bang, I'm sorry sir. Pinagtatakpan mo, parang sinasabi mo, kasi sabi mo, unless makita ka ng hard evidence, hindi ka magsasabi ng kahit na ano about those people from PhilHealth who were accused of corruption. Mismo na si Presidente Duterte, inadmit niya na may corruption eh. Diba? Kaya nga gumawa siya ng paglilinis. Gumawa siya ng pagpapaimbestiga, naglagay siya ng mga bagong tao. Even the President was aware, fully aware that there was. And then here you are, sinasabi mo wala unless na mayroong proof. Diba, sir? Please don't.
Okay. Siguro, Mr. Ledesma, naiintindihan ko yung, yung position ni Sen. Rafi. We know for a fact that in the past, PhilHealth was hounded, no, by several issues, no, yung upcasing, yung connivance, no, that yung nauubos yung pera ng diba? Because benefits yung mga OFW or employees, syempre they pay the premium, dapat alam nila na maayos yung agency. So probably ang nyo, since you are new to the job, that you have to admit that we need to reform and clean the agency. No, kasi we have to make sure that the funds will go to those who really need it. Diba? Kawawa naman, may upcasing, Sen. Rafi, magkakaroon dyan, simpleng bronchitis, gagawin ng pneumonia, severe pneumonia para tumaas. So, connivance between doctors, PhilHealth, and the patients. So, yung kailangan nating ayusin at linisin. And siguro, yun ang gusto ni Sen. Rafi, we have to admit that there is a problem. Yun ang, I think, yun ang punto ni Sen. Rafi. And probably, Sen. Rafi, with your indulgence, we will probably in connection with the implementation of UHC, kailangan na pag-ayos din ng PhilHealth. We call for a separate hearing na yung PhilHealth naman talaga ang yung problema ng PhilHealth, and we will gladly have si Rafi yung support nyo and tulong nyo para talaga may ayos natin ng agency.
Okay, Mr. Chair, kasi on record naman talaga yung mga sinabi niyo po. Diba? Yung mga pagpa-file ng bogus claims. May mga na-file ng kaso niyan. Nasa korte na iba dyan. May mga ebidensya na. Diba? Na yung mga doktor, mga clinic, ospital, nagpa-file ng mga bogus claims, overpriced, overcharged. And now you're saying na unless talagang makita mo o ma-prove, hindi ka maniniwala. Come on, guy. I'm sorry, sir. I'm really sorry about you. I feel sorry about you. I feel sorry about PhilHealth. Kung katulad niyo po ang magpapatapo ng PhilHealth, I feel sorry about PhilHealth and all the members. Kung ganun rin lang po yung estilo niyo po pagpapamalakas sa PhilHealth. I'm sorry. Unless kung babaguhin niyo po yung inyong pananaw, attitude sa pagpapatakbo ng isang agency na graft-ridden, was well known to be graft-ridden for a year or two or for many years, then wala akong mangyaring pagbabago. Baguhin niyo po yung inyong pananaw, yung inyong estilo of governing. Change it. Because if you don't, then again, I repeat for the end time, I feel sorry for PhilHealth and the members. Thank you, sir. Thank you, Mr. Chair.
Thank you, Sen. Rafi. Again, we expect the cooperation of PhilHealth. We will probably ask the chairman of Committee on Health for another hearing para doon sa reform that you need. No? Kailangan na magtulungan po tayo. No? So, naintindihan natin kay Sen. Rafi kasi yan ang dulog pinupuntahan ng mga mga biktima. Kaya we acknowledge yung kanyang contributions because these are coming from the ordinary folks. Yun ang wala mapuntahan kay Sen. Rafi nagsusumbong ng mga nangyayari. So I hope for your cooperation in the rehabilitation and reform for PhilHealth. Probably we'll hold it on a separate hearing. Also, before we continue, the chair would like to acknowledge on the online presence of Senator Pia Cayetano, one of our health advocates. And siguro para bago umalis si Sen. Rafi kasi meron siyang appointment at 11:30. Yung sa DMW, we invited them. Kaya lang, they did not, they only, meron online, no? Si ASEC Jerome Pampolina. Is he present para marinig natin yung concerns ng OFW, yung pong inilabas si Sen. Rafi kanina so that we can confirm, no? Is ASEC Jerome Pampolina online?
Yes,
Sana
Your
nga.
Honor.
Thank you for joining us, but we would have
Morning, Your Honor.
sana po next time be physically present, no? Mas maganda kasi physical presence. So, siguro, ASEC, yung po siguro kung nakikinig ka kanina, yung po mga issues that were brought up by Senator Rafi Tulfo, yung pong mga concerns ng mga OFWs, ano pong masasabi nyo rito na siguro yung position na ng DMW, no? Regarding the different issues on premium hikes. Ang ano lang kasi dito, merong rapid may nag-text na from Hong Kong OFW na sa ating live na marami ang hindi alam na pwede lang reimburse. Ang kulang talaga ng PhilHealth, ang ating agencies, information. Marami ang mga nagre-react kasi wala namang nakukuha. Pero halimbawa, ang DOH, no? Mga benefit packages natin, nag-level up na. Kaya lang, hindi alam ng lahat. I think doon tayo nagkukulang sa information campaign. But before you, Mr. Malindesma siguro. Sige, Mr. Rafi.
Yun nga, Mr. Chair, sabi ng taga-Hong Kong na OFW sa atin, hindi nila alam na meron palang ganun pwede mag-reimburse. So kung hindi nila alam, bakit lumilitaw dito sa record ng PhilHealth, bilyones ang nag-claim sa kanila? Kung hindi nila alam. You follow me, sir? You know where I'm coming from. You see? So kaya it defies logic yung sinasabi niyo kanina. Bilyones ang kiniklaim ng mga OFW. Samantalang sabi ng mga OFW, hindi nila alam na meron pala ganung klaseng programa na pwede pala sila mag-reimburse when they come home to having been sick abroad.
Sige, briefly, Mr. Ledesma, tapos we go to ASEC Jerome Pampolina habang nandyan siya.
Yes.
Answer yung concern ni Sen. Rafi.
Yes. Thank you, Your Honor. One of the issues, in fact, we were just discussing in a planning meeting the other day. One of the issues I felt that we want to highlight with our program for PhilHealth reforms, no, if ever is the dissemination of information to everybody, no. I feel kasi maybe like we can improve on that side, no. Maybe people are not aware or people don't know of the benefits or what PhilHealth has to offer, and we feel strongly that we have plenty to offer, no. So just want to assure your honors that again, we are working on that, and we will improve the dissemination of information to our people, your honor.
Thank you, sir. Information dissemination para malaman na nilang lahat ng mga OFWs na pwede pala sila mag-reimburse kapag sila ay nagbayad doon nang sila magkasakit sa abroad. Then, only then, kapani-paniwala na itong sinasabi niyong bilyones na claim ng mga OFWs. I guess nyo, sir? So, kaduda-duda talaga yung sinasabing bilyones noong 2021 na reimburse sa mga OFWs. Kaya nga po, doon pa lamang tataas ng kilay natin lahat na korupsyon.
Oh, one more quick comment, your honor.
Siguro before you comment, please provide yung put in details.
Yes,
lahat
exactly.
po ng documents para po
Exactly.
mabigyan natin si Rafi Tulfo.
That's what I wanted to mention to Sen Tulfo, Honorable Sen Tulfo, that, well, we will provide in detail. And I think, because I understand where you're coming from, Senator, yung argument nyo, no? Naintindihan ko po.
Yes,
So, I think the best way to address this is to just come out with the full information in all details. Then we can discuss, and I think it will be very clear to you po where it all came from po.
Okay. And lastly, Mr. Chair, I would like to apologize to Mr. Desma. Bago nga lang po kayo. So nag-grill po kayo. But you came in not prepared. And kaya po nag-init ang ulo ko rin sa inyo dahil magkaiba kasing estilo ng pamamalakad nating pamumuno natin. So nag-clash tayo. And kung kayo po ina-offend sa mga narinig nyo sa akin, I apologize to you. But next time, ibahin niyo pong estilo nyo sa panunungkulan sa gobyerno para magbe-benefit po yung taong bayan. Okay, sir? Thank you, sir. Have a nice day, sir.
Mr. Chair, walang problema. I fully understand. I was not offended po. In fact, I just really decided po when I accepted this position na I will just work hard, be honest, do my best. And again po, if how I feel or what I said, tensya na rin po. Kung hindi kayo masaya, so sinabi ko, again, ako talaga, trabaho lang talaga po. We're just really here. Kami, mga alalay lang po kami, and we just want to assure you that we will really do our best. Thank you po.
Thank you. So we go to ASEC Jerome. Thank you. Si ASEC Jerome Pampulido of OFW para we can move on to the topic after the OFW. Tinatch na natin, no? Kasi Sen. Rafi kasi yung concern. Then we go back already to the funding agencies, no? PCSO, PAGCOR, DBM, and DOF. Okay. Si ASEC, please, can you, kung ano po, yung sa mga issues to discuss, can you say something? Before we move on, the chair would like to acknowledge the chair of the Committee on Health and Demography, Senator Bongo. Thank you very much, sir, for joining us. And also, thank you very much for allowing the subcommittee to be formed para po itong sa amendments ng Universal Healthcare Act. Sige, please, you want to issue statement? ASEC, Jerome, sige po, any, from position of the DMW.
Thank you very much, Your Honor. If I may just make a statement for the Department of Migrant Workers, with the permission of the Chair. First of all, we'd like to thank the honorable authors of the bill amending the Universal Healthcare Law or Act for continuing to champion the welfare of OFWs and their families. We note that our legislators recognize the unique circumstances of OFWs and their families, as mentioned by the Honorable Senator Tulfo, that a significant number of them has lost their jobs during the pandemic. We recognize that the sector is still recovering from the effects of the pandemic, and that most of them, they are already covered by insurance in their countries of employment, either through employers or through the government. So in line with that, Your Honors, Mr. Chair, the department recommends the following framework for the consolidation of the bills. First, that the updated payment of contributions should not be a requirement for the issuance of overseas employment certificates and should not bar the OFWs from being deployed. So the DMW has already made an advisory on this. And the PhilHealth contribution is not mandatory in the issuance of the OACs. So second, that the OFWs will not be mandated to pay premium contributions upon their arrival to the country, and that the mandatory contribution may be started only upon employment within the country. So what we propose here is that contributions, perhaps PhilHealth can help with this. If they can make an arrangement for OFWs to make premium contributions only when they are repatriated and have been employed in our country. So the third framework which we propose is that given that the nature of an OFW, given the nature of the employment of OFWs, we also recommend that they should not be charged with penalties for delayed payment of contributions. Considering also the pandemic, the issue, the present state of the economy during the pandemic, we strongly recommend that penalties be either waived or delayed. So we also recommend that the bills include condonation of previous penalties so that our OFWs will be relieved from their economic situation during the pandemic. So we further state or urge that the committee consider making premium contributions voluntary for the OFWs and to also explore the possibility of using a fixed rate which may be adjusted by the PhilHealth Board. We also support the inclusion of a provision that would allow the President, upon consultation with relevant agencies and stakeholders, to suspend the collection and increase of contributions for specific sectors. This would give the President the capacity to act quickly during national emergencies, especially now during the pandemic. That will be all, Mr. Chair. Thank you very much.
Thank you, Asik Jerome Papolina. But anyway, this is a very important hearing. This is a landmark legislation, no? I would have preferred that you would have been here, anybody, for be physically present. Although may online na tayo, iba pa rin yung physical presence because we are discussing ang hirap ng online. Nagja-choppy kayo, hindi namin kayo maintindihan, no? So I hope that next time, ang dami nyo naman dyan dinagdagan ko pa ang budget nyo ng 1 billion. Don't tell me that nobody is available for to be physically present. And dito nga, Chairman Juni Coa, PCSO, PhilHealth is here, Anday, Quezon City galing, DOH is here, USEC. So next time, sorry wag niyo babaliwala ito concern ng OFW to, DMW. Diba?
We apologize, Your Honor.
It's still different Yung audio nyo ang labo-labo. Andito pa ang chairman natin. Well, we understand the reason why we are proposing for an amendment for the UHC because of the unang-una nagka-pandemya. Talaga nobody foresaw this. The implementation of the UHC was during the pandemic. I'd like to thank Senator Bongo kaya nga pinayagan tayo para maipasa na natin ito. Then President Duterte twice nag-issue ng EO suspending premium health hikes. And me as the principal sponsor, I supported that because we have to adapt to the situation. We understand the situation of our employees, both government and OFWs. We are all, kumbaga lahat tayo nahihirapan dito. That's why we want to kaya tayo nag-hear para marinig natin kung ano ang kaya ng PhilHealth. We have to balance, no? We have to adjust. In fact, yung increases, we will already adjust the dates, yung contributions, para makabawi muna tayo, no? So, we want to make it clear also, yung sa OFWs, wala tayong intensyon na pahirapan po sila, no? Tama po yun. OFWs are insured, especially in Commonwealth countries like Canada, Australia, insured kaagad sila. But, yung po hindi kasi alam ng ibang OFWs, dapat informed din yun sila. Yung po mga dependents nila that will be in the country, yun po ang sinusolder ng PhilHealth. So hindi pwedeng sabihin na wala silang nakukuha. Because their family members who are left behind, nakaka-claim sa PhilHealth. Tama po, no? So siguro kulang tayo ng information campaign. They don't even know OFWs that they can reimburse yung pong hospitalization ano nila expenses abroad. Pagkukulang na po yan ng ating agencies kasi hindi natin disseminate ng tama. Ang ganda po ng UHC. Problema, hindi alam ng taga Hong Kong na pwede sila mag-reimburse. Hindi alam ng mga taga Canada na OFW na pwedeng pamilya nila ay magbenepisyo rito. So probably it's information campaign. If you can only also through the DMW communicate, siguro Yusek Kenneth, alam mo no, yung pong benefit packages, you can give them a copy na nag-level up na rin tayo. For example, sa operation ng kidney, yung mga Z packages natin, ang tataas na 600,000 for open heart surgery, 500,000 and so on. No, ito hindi alam ng ano eh. So baka doon lang tayo. But anyway, Asik Jerome, I hope you'll be here because we will try to get a balance. Kung ano yung acceptable sa OFWs natin, I lament, we understand the situation of OFWs. Ano natin sila? We consider them as our modern day heroes. Hindi natin intensyon na sila ipahirapan or maging pabigat. So kung ano yung kaya nila, para po rin naman po yung kanilang pamilyang may iwan dito, hindi na nila problemahin. That's the intent why we included the OFWs for contribution na may magkasakit man dito na hindi na nila problema, hindi na sila kailangan magpadala. Ang PhilHealth dapat sumagot through the UHC para po sa kanilang problema. So we will take note of that. Please submit to the committee yung pong mga recommendation ng DMW. And probably we will have another committee with the indulgence, with the permission of our chair of the Committee on Health kasi hindi natin matatapos to eh. No? We will now hear our funding agencies pero yung DMW concerns as I committed to Secretary Toots Ople that we will indeed hear yung mga ano, what will be acceptable and kung ano yung magiging magaan sa OFW natin, no? Maganda nga yung voluntary, no? There is a bill by Senator po na gawin na natin voluntary, but again, ano eh, meron pa rin, ano eh, tingnan natin mamaya kung anong sasabihin ng PhilHealth doon. We will find a compromise. And I think I have something in mind that I can propose, siguro kung Asik Jerome. Ang iniisip ko rito, probably just like yung mga private companies or sinushoulder po ng company, yung kalahati na contribution, di ba? So,
Yes, sir.
probably that siguro initially, habang nandyan kayo, probably if PhilHealth can study this also, PhilHealth will shoulder, government will subsidize the contribution or half of the contribution of the OFW para hindi mabigat. So kalahati na lang ang babayaran ng OFW, kalahati will be subsidized by the government. Yan ang nakikita na yung compromise. So please take of that. Pag-aaralan po natin yan kung kaya. So, i-take note nyo rin na Asik Jerome and please discuss this with Secretary Toots para po kalahati na lang babayaran ng OFW because meron pa rin silang benefit as records would show. Dito po, members ng OFWs natin, migrant workers, 3.3 million, dependents, mga 2.5 million, beneficiaries, 5.8. Tsaka yung claim, malaki din, no? So yung pong may iwan po nila, hindi nila po problemahin. So we will have a balance, no? Pag-uusapan pa natin, mahaba pang usapin to. Okay, please stick around. Please take note of that na yun yung nakikita naming pwedeng compromise. Whether acceptable that, we will hopefully you can join us in the next discussion.
Thank you, Your Honor. Thank you,
Siguro
Your Honor.
thank you, Asik Jerome. We will move on already to the funding agencies. Sembongo, meron ano?
Salamat, Mr. Chair. First, I want to thank you for leading the discussions on the bills amending the Universal Healthcare Act. As the principal sponsor of the UHC law during the 17th Congress, it is befitting that Senator J.V. Ejercito is heading this subcommittee of the Committee on Health and Demography. Mr. Chair, the 17th Congress passed the Universal Healthcare Law with the objective of ensuring that all Filipinos are guaranteed equitable access to quality and affordable healthcare. That is why today all Filipinos are already considered members of PhilHealth. To ensure sufficiency in funding and to keep the financial viability of PhilHealth, the UHC mandates a schedule of premium contribution rates which increases until 2025. Mr. Chair, alam naman po natin na hindi natin inasahan ang nangyaring pandemya at krisis na pinagdaanan natin. I am certain that when the 17th Congress included in the law the premium rate increases, no one in this chamber knew that was what was about to hit us. Kaya naman po sa tingin ko, nararapat lang na ipagpaliban po muna ang pagtaas ng kontribusyon sa PhilHealth para makatulong tayo sa pag-recover ng ating mga kababayan mula sa pandemya. Naalala ko po noong mga 2020, pinagpaliban rin po ni dating Pangulong Duterte. Twice. Talagang maraming reklamo, maraming apektado nating mga kababayan, mga OFWs, nawalan ng trabaho, naghirap, umuwi. Tama rin po na pagpaliban muna natin. At nararapat na ipagpaliban muna natin sa ngayon ang contribution sa PhilHealth para makatulong tayo sa pag-recover ng ating mga kababayan mula sa pandemya. Marami ang nawalan ng trabaho at marami po ang nagsara na negosyo. Sa mga ordinaryong mamamayang araw-araw na nakipagsapalaran, ano ba ang mas mahalaga sa kanila, ang dagdag na kontribusyon o yung pangunahing pangangailangan ng kanilang pamilya? Kaya naman po, bilang representante ng mga mamamayang Pilipino, obligasyon po natin na makinig sa kanilang hinaing, ang magmalasakit sa kanila at gawin ang lahat, maibsan ang lahat ng pabigat sa kanilang dinadala sa araw-araw. In this time, every single peso counts. Mr. Chair, it is for these reasons that I endorse the bills granting the President of the Philippines the authority to suspend the scheduled increase in PhilHealth premium contribution rates, specifically in times of a state of national emergency, national calamity, or public health emergency. Karamihan po sa mga OFWs natin umaasa lang po sa dagdag na tulong mula sa gobyerno, lalo na yung mga nawalan ng trabaho at napektuhan ang kanilang kabuhayan sa ibang bansa dahil sa pandemya. In fact, namigay nga po ng tulong yung dole ng mga panahong yon. Hindi po naman po tama na sa panahong walang-wala sila, doon pa natin sila sisingilin ng dagdag na contribution. Lahat ng palugit na pwede nating maibigay habang tayo ay nagre-recover pa, kung maaari po ay maging flexible tayo at ibigay po natin sa kanila. Pansin lang po natin ito para hindi rin po mailagay sa alanganin ang kabuuang pondong pangkalusugan na makakatulong sa mas maraming Pilipino. Ako naman po, suportado ko po ang PhilHealth dito dahil alam kong ginagawa nyo rin po ang inyong trabaho. In fact, nung nakaraang budget hearing for 2023, kami ni Senator JB ay full support po sa pagdagdag pondo po sa PhilHealth. Mr. Chair, meron na po akong isingit. Alam po natin na sa kasabay po ng pagtaas ng premium, kailangan din pong i-improve ang mga benepisyo ng PhilHealth. That is why I want to particularly ask PhilHealth benefits. My proposed special provision under the PhilHealth 2023 budget indicating the use of the 21 billion budget pertaining to benefit package improvement under Universal Healthcare Act was adopted. I earlier proposed that this budget should be used for the expansion of free dialysis coverage, mental health outpatient coverage, the implementation of the comprehensive outpatient benefit package, including free medical checkup and other increases in benefit packages. Malapit po sa aming mga opisina, humingi ng tulong sa dialysis, maraming humingi ng tulong para ma-expand ang dialysis coverage ng PhilHealth. It is the reason why I filed Senate Bill 190 mandating PhilHealth to fully cover all costs of dialysis treatment, session, and procedures done in PhilHealth accredited health facilities. Pero kung kaya naman po itong ma-implement po ng PhilHealth ngayon, lalo na at mayroong budget para dito, mas mabuti. May I know lang po, sa PhilHealth, is PhilHealth planning to further expand dialysis coverage? How many sessions do dialysis patients usually need, and how many sessions are they planning to cover?
Mr. Chair.
Please, Mr. Manny Ledesma.
Good morning, Senator Go, Your Honor. To answer your question, yes po, we are planning to expand. In fact, as early as, we will announce it already as early as next month po. To increase the hemodialysis sessions from the 144 to 156 po. No. So, it was going back from 90 to 144. Now po, 144 to 156 po.
Kahit na meron tayong suspension ng contributions, kaya nyo pa rin.
Yes po. Walang problema. And to expand further po, so we will announce that next month, no? Then just to add also po on regarding, because you're talking about the case packages, no? Yung case rates po ng PhilHealth. It's been quite some time na-adjust yun, no? Again, as early as next month, we will yung top 5 case rates, the new case rates, no? Which is substantially higher. We will also come out with the official announcement on those po. So those are just some of the number of benefits which we are going to improve in the short term po.
Konsulta program, ilang Pilipino na po ang nakapag-register, nakapag-enroll sa programang ito. Anong laboratory test po ang covered? Isinulong ko po yung free medical check-up para sa ating mga kababayan. Pati po ito ng UHC.
Yes po, thank you for that question po. If I may be allowed to ask our COO, Attorney Eli, to expound on the consulta program. And thank you po.
Attorney Ilay, siguro yung query ni Chairman Sen Bongo tungkol sa consulta program daw kung ilan yung nag-avail na.
Mr. Chairperson, Honorable Senator Bongo. The data available with me is as of October 31, 2022. We have registered beneficiaries of 2.4 million, Mr. Chairperson. I'm sure that this has increased towards December 31, 2022. Our target for this year is to cover 50% of the population, Mr. Chairperson, Honorable Senator Bongo. And as to the services, we have under the consulta package, we have 13 laboratory services, and we cover 21 drugs and medicines. We provide consultation, preventive health services, and assistance in accessing services in other facilities. So the consulta program is also a referral system to other higher level facilities. Mr. Chairperson, Honorable Senator Bongo, sir.
Salamat po, Attorney Eli. Kala ko Eli. Siyempre, hindi rin natin nakalimutan po yung para sa ating medical health program, lalo na sa panahon ngayon, maraming crisis ang kinakaharap ng ating mga kababayan. Napaka-importante po itong mental health cases. How much is the current PhilHealth coverage po for mental health cases? Meron ba silang, do they have outpatient coverage? What is the plan of PhilHealth for the benefit packages of mental health cases and consultation po?
If I may, Mr. Chairperson. Mr. Chairperson, Honorable Senator Bongo, for this year, 2023, we will roll out the mental health package as an outpatient benefit package. As at the present, Mr. Chairperson, Honorable Senator Bongo, we do not have yet the specific amount of the package, but together with the announcement of our President and CEO, Ledesma, we will include the announcement of the package on mental health for this year. We are sure, we commit to roll out the mental health package for this year. Honorable Chairperson, Honorable Senator Bongo. Thank you, sir.
Salamat po. Last question. Ano po yung mga ibang packages does PhilHealth plan to expand and improve this year? Paliwanag natin na maayos ang lahat ng mga benepisyo ng pagiging membro po ng PhilHealth. Kumpara po ang kabuuang halaga ng binabayaran ng premiums sa kabuuang halaga po ng lahat ng benepisyong nakukuha nila at ng kanilang pamilya para po maintindihan rin po ng ating mga kababayan.
If I may, Mr. Chairperson, Honorable Senator Bongo, sir, to the leadership of our CEO, Sir Mandy Ledesma, we were directed to implement, despite the suspension of the increase in the premium for this year, we were directed by our President and CEO to implement the Consulta package. And we have this severe acute malnutrition package. This is an outpatient therapeutic care. And also, as I've said a while ago, the mental health package, and that is for 2023. These three benefit packages are covered by premiums. Mr. Chairperson, Honorable Senator Bongo, we also have benefit expansion that will be covered by the contribution by the PCSO and PAGCOR. And those are the increase in the hemodialysis sessions from 144 to 156 sessions for 2023. And for 2023 to 2025, our President and CEO already stated that we will roll out enhancement of the all-case rates. But for this year, we commit to roll out at least 5, Mr. Chairperson, Honorable Senator Bongo. And likewise, we commit to develop Z-benefit packages, enhancements of our Z-benefit packages that will cover orthopedic implants, kidney transplant, breast, prostate, cervical cancer, and open heart surgery. So, Mr. Chairperson, Honorable Senator Bongo, again, through the leadership of our PCO, despite the suspension of the premium increase, we will roll out benefits as planned. So this will not affect our planned rollout. We will adjust, we will strategize, and through the leadership of our PCO, we commit to do this, Mr. Chairperson, Honorable Senator Bongo. Thank you very much.
Salamat po, Sir. Salamat sa PhilHealth. Mr. Chair, alam naman po natin na to complement the Universal Healthcare Act, we passed the Malasakit Centers Law. Papasalamat po ako sa PhilHealth, papasalamat po ako sa PCSO, sa DOH, DSWD. Isisingit ko na lang po, may I know po the updates from the PCSO sa PhilHealth at sa ating wala po yung DSWD dito. May I know the updates from DOH, PhilHealth, and PCSO on the implementation of Malasakit Centers. Under the law, DOH, PhilHealth, DSWD, and PCSO are mandated to provide personnel in Malasakit Centers, especially in DOH hospitals and the PGH po. Ang pagkalam ko, PhilHealth, wala naman pong problema. I think yung DOH rin po. Mr. Chairman, sisingit ko na lang po, kumusta po yung mga malasakit centers natin, yung mga personnel po nila.
Thank you so much, Chairman Bongo, for your query. In behalf of the PCSO, I'd like to update Your Honor on the status of our deployment of personnel into the malasakit centers. Out of 163, 153 centers, we have thus far deployed 114. And we continue to move on and recruit more people so we can complete the commitment of PCSO in the Malasakit Center Law.
Maraming salamat po, sir. Tuwing Mr. Chair, tuwing umiikot po ako sa mga ospital, pag-check sa Malasakit Centers, pagbubukas, nandiyan naman po, nakita natin yung support ng PhilHealth, ng DOH, DSWD, and of course, ang PCSO. Isa lang po ang pinagbibilin ko sa kanila, lalong-lalo na po sa medical chief, sa mga social worker at mga frontliners natin, na unahin po yung mga mahirap, bigyan talaga ng atensyon at asikasuhin po sila ng maayos. Usually naman po, pupunta sa mga government hospitals ay yung mga mahirap nating kababayan. Yun lang po ang paalala ko, sir. sa PhilHealth, DOH, PCSO at DSWD, pagbilin po natin sa ating mga personnel na asikasuhin po yung mga mahirap, yung mga helpless, yung mga hopeless po. Maraming salamat, sir.
Thank you, Mr. Chairman. We assure you of our commitment, the PCSO, to the noble cause of the Malasakit Center Law.
Thank you, Chair Committee on Health, Demography Center Bongo. Thank you also. I'd like to take the opportunity to thank you, and all President Duterte that during the height of the pandemic, yung suspension, I fully support that, because we have to adapt to the situation, na talagang gusto natin din hindi mahirapan yung ating OFWs and local employees, So the reason why siguro ang target natin dito, what are the rates na kaya ng PhilHealth, because we will propose for kumbaga i-defer natin yung increase. Now we'll have increases, but siguro lang natin sked na kaya. We have to give our workers, our OFWs and local workers the chance to be able to recover from the pandemic. If needed, we will just subsidize kung ano man ang kukulangin, because ayaw naman natin pahiratan yung ating workers, And likewise, so we will move on already para ito na talaga meet nung ating hearing. We heard already the funding gap, yung pong wish list, kumbaga yung high scenario ng DOH, so that the implementation of the UHC will be done as soon as possible, according to our timeline. So we will now hear from BBM, DOF, PAGCOR, PCSO, and then lastly PhilHealth, kung ano po yung kaya na ibigay at yung kaya nating tawag doon, yung kaya nating tanggapin, na propose natin na rate sa ngayon. Okay, so maybe we can ask DBM. Is DBM present? Ang target kasi natin, hopefully we can pass this amendment as a law already, amendment, both House and kasi po sinuspend ni President BBM yung premium rate hikes, and we understand that, kaya nga we will now fast track this na para po in effect pa yung premium, yung suspension pag naipasa natin to, so there's no more need for another EO next year. Okay, so sa DBM po siguro briefly yung gist na lang, kung meron kayong position paper, lahat po ng agencies, to make it quick, sana matapos by lunch, di ba? May lunch naman yata tayo ngayon, but to make it quick, siguro yung gist na lang or summary of your positions, tapos yung pinaka-position paper, you submit it to the committee. And probably if needed, we will call another hearing. But if not, siguro i-ano na sa TWG. Yes, sa DBM please.
Good morning, Sir Chair, Senator Bongo. For the general comment of the Department of Budget and Management, we interpose no objection to the proposed legislative measures, subject to the inputs of the Department of Health, the PhilHealth, and other appropriate agencies with functional jurisdiction on the matter. As regards the 21 billion allocations or appropriations mentioned by Senator Bongo, we are yet to receive the request from the PhilHealth regarding the release of the said fund. Thank you, sir.
Anyway, ang siguro we can just ask DBM kasi kayo yun lagi nag-i-slash Trabaho niyan Di ba? Trabaho namin magdagdag pero kayo lagi nag-i-slash. But I'm just hoping that anyway, si Sekmina naman dyan who came from the Senate, she understands perfectly how we work here. So yun yung ang pinaka-advantage, So the biggest problem that I see, as discussed by you, si Kenneth Ronquillo, is the funding gap. Nasa GA natin, 315 billion para makahabol po tayo doon sa UH implementation para scheduled. Pero yung scenario na is over 570 billion. So siguro na lang if we will ask DBM to SecMina that UHC will be one of the is a landmark registration, and if this becomes successful, siyempre ang administrasyon, no, I think ito yung pinaka-proof that the services are really kumbaga, pag yung health services is okay, ibig sabihin the administration is performing very well. So yun na lang po siguro, if you can help in the funding and itong pag-an natin, no? Hindi yung funding gap masyadong malaki, but we'll see what we can give para po against sa work in progress kung para scheduled by 2029 sana po fully implemented ng UHC. Because of the that it has received, well, nagkaroon ng pandemya, syempre nade-delay din yung full implementation eh. Di ba? So we want it fully implemented para maramdaman natin agad na ating mga kababayan. We will get back to DBM. So we can ask ito pa pala, nakalimutan. During the budget, nung the BICAM, nag-request kasi ang PhilHealth ng admin expense, no? Dapat 7.5. What was only approved was 5%. So ano po maging effect nun? Siguro Attorney Eli or Manil Desma, Mr. Manil Desma, dun sa hindi na-approve, 5% lang eh. Dapat 7.5 yung requested nyo for admin, for implementation. Will it affect the implementation of the UHC?
Pero I'll answer briefly and then I will allow our COO, Attorney Eli, to expound on my answer. No, based on my understanding po, I think for this year, no, the although we were hoping for 7.5%, no, I think kasya naman yung 5, no. But the worst that we can do is, you know, we're waiting for we have a pending reorg from GCG, no. If that gets approved, maybe what we will do is we will just push back slightly. Kasi by the time that gets approved and by the time we implement, roughly po kasi that's an increase of around 2,000 employees, no. Hindi mo pwedeng agad-agad yan eh. So I think by the time we reach that point, it will already be the year after. So initial thinking ko, the 5% for this year will be sufficient enough po. But we are hoping po that next year, sana we be given the maximum or even more kung pwede, no? Yun lang po.
So you're saying that you will make do first with the 5%?
As my understanding is yes. Now, assuming po, again, assuming let's say GCG.
Kung 7.5, for what purpose ba yun dapat? What improvements can we see sa admin nyo? Or paano maging more efficient? Is it for efficiency? Sige, kayo po, na lang. Kasi 2.5% medyo malaki rin yun eh. But
Yes.
we tried hard kami ni Congresswoman Stella Kimbo.
Yes.
No, kaya lang ang na-approve talaga is 5%. Si DBM kasi kinat ng 5%. Ano pong ano nyo? I think po that two services will be affected.
Yes. The 2.5% translates to roughly, if I'm not mistaken po, around 4.5 billion po yun, no? Now, again, it kasi depends on, number one, yung reorg ba namin, approve ba ng GCG, will that be increase, decrease, no? So, everything is still fluid po. But, again, basing it on last year po, kasi last year po, na-approve yung 7.5 sa amin, hindi naman na-utilize, no? Na-fully utilize. So, again,
That's the reason why it was cut by DBM. Kasi pa hindi na-utilize, natural yun kasi masasayang. Talaga ikakat nila yan. So siguro tanong na lang natin, kanina yung concern ng sinabi ni Sen. Rafi, yung laging prevalent, yung fraudulent claim, sabi mo, press money that you will prioritize computerization, no? Digitalization. So will that be part of this malaking 4.5 billion, no? Yung 2.5%, kasama na ba yun sa program natin?
again po, example, let's just, on the surface, we'll touch on computerization or digitization. By the time naman this is fully implemented, hindi naman year. Maano yan eh. That also takes time. So again, I will allow Attorney Eli to expound, no? Ang feeling ko for this year, 5% lang yung na-approve sa JA, I think it will be sufficient enough. At the same time, I want to add, sana lang po, for next year, no?
If you will really say that talaga ipupush natin yung digitization, computerization, because that will solve a lot of problems. Lalo yung fraudulent claims, yung mga ma-solve natin yun eh. Kasi lahat we will have database already. Ngayon, mano-mano. Alam naman natin, pag mano-mano, nandyan ang mga magic eh. Yung mga bura-bura, nawawalang records. So, in the same way that other agencies ay try to computerize and digitize, yun talaga mag-aano dyan eh. No? So, if you're saying that yung additional 2.5% will be used for that, talaga ipupush natin. Hopefully, DBM is here. Di ba? Nakikinig sila ngayon that it will be also used for that, no? Kasi gusto natin matanggal lahat ng irregularities and fraud. So, so you're saying that 5% you'll make do with that for this year?
Well, yes po. But again, if I may allow Attorney Eli to expound po on the other details po.
Sige, Atty. Eli, briefly, because we have to hear others pa, no? After DBM, at least nandito sila. Hindi ko sila pinapagsalita para makinig sila. Para bawasan ang cuts. So that they'll understand. But you have to utilize. Kasi ganun talagang DBM. Pag hindi nyo ni-utilize, natural yun. Di ba? They will really cut the budget for next year. So you have to make sure that yung 5% nyo magamit nyo fully this time so that next year, they will also recommend yung 7.5%. I think that's a natural reaction of DBM. Kaya nagkakaroon ng budget cuts pag yung underutilized yung inyong budget. Attorney Eli, please.
Mr. Chairperson, as stated by our President and CEO, we will make do with the 5% for this year. This will affect the reorganization of PhilHealth, the digitalization, and the rollout, the human resource side, the rollout of benefits. But then again, on the rollout of benefits, we commit to stick with the plan for 2023 as well as next year. We want to emphasize, Mr. Chairperson, that for next year, if we will not achieve or acquire or get the 7.5% admin limit, it will really affect the operations of PhilHealth because admin cost pertains to personal services and MOOE. So we need to fully implement the reorganization plan of PhilHealth. This should be implemented this year. Again, as stated by our President and CEO, Sir Mandy, we will make do with whatever was given to us. Mr. Chairperson, again, emphasize, we reiterate that we need to have the 7.5 admin cost limit for next year, 2024. Mr. Chairperson, thank you very much, sir.
Before we move on, next will be the FBIR for the funding, yung pong ano nila na for their positions. Senator Pia Cayetano, isa sa ating health advocates and support of UHC, is with us online. Sen Pia, if you're online, you might want to make any statement. Or you may want to ask, nandiyan ba si Sen Pia? So while we're waiting, please prepare yung DBM, DOF, BIR, PAGCOR, PCSO, and lastly PhilHealth namaya, para doon na sa kaya natin, doon sa bago nating schedule ng rate hikes as adjusted. Kasi ang target na natin, again, that while the suspension order of the President is in effect, para hindi na siya mag-issue, may ayos na natin bago matapos yung taon. Okay? Pag wala si Pia, then we can move on. But she can butt in any time. So DOF, BIR, anything you can say? DOF, meron ba DOF? Ayun, no? Attorney Ann Marquez.
Good morning, Your Honor, Mr. Chair. For the DOF and the BIR, we fully support the passage of the bill since it will greatly help the Filipino people, especially the migrant workers. For the funding, The tax code provides that certain percentage of sinful taxes collected shall be allocated for the implementation of the Universal Healthcare Act. To be specific, sweetened beverages, 80% to 50%. For alcohol, it would be 60% of the 100% of collections. Tobacco, 80% of the 50%. Heated tobacco, 60% of the 100%. And for the POGO, 60% of the 60% of the collections. The allocation for the information of everyone shall be based on the actual collection of the second fiscal year preceding the current fiscal year. As requested, I have the information on the actual collection and target collection of sin taxes, particularly alcohol and tobacco products for years 2019 to 2021. We'll submit to the committee a full report on this on due course po. That's all, Your Honor.
I'd just like to clarify, no, Attorney Ann, kasi medyo yun, very controversial yung issue ng POGO. No? Marami yung gusto ng stop siya because of the social cost. But siguro maybe can ang sabi kasi ni Secretary Ben is that yung projected income when the law was passed on offshore gaming, dapat 20 billion yata yung projected income or more. Nasa 3 billion lang daw ang nakuha natin. Do you confirm that? Bakit ganun kababa lang yung nakuha natin?
Your Honor, I don't actually have the data regarding the POGO, but the Statistics Division of the Bureau is already preparing that, and we will submit the said report once I collated all the reports po. I don't have the alcohol and
Please submit that because that will help us also in our decision
Yes.
regarding the fate of the POGOs. Hindi rin naman kami pro-POGO, but personally, I think yung mga out, dapat ma-out na talaga yung mga illegals, but we are also benefiting from it kasi 60% of total revenues from gaming tax on offshore gaming licenses
Yes,
will
po.
be allocated to UHC.
Yes po,
Ako,
60% of
Anti-POGO talaga ako, pero kung ganito kalaki, kung gaano kalaki, depende. Di ba? Sayang din. Di ba?
Yes po.
But of course, we will prioritize the social cost. Kung talagang gano'n nakagrabe, then we have no choice. But we please submit the data
Yes po.
on how much we were able to collect from the POGO operations. Kasi ang PAGCOR, meron na nga ang PAGCOR. Dapat may PAGCOR ba dito? Di ba? Where's PAGCOR? PAGCOR is here, no? At, nagkaroon tayo ng hearing. Meron silang third-party auditor na dapat sila nag-audit kung
Yes.
talagang magkano dapat mapunta sa atin. So, the chair would like to get that data as to how much is being repeated to the national government, to PAGCOR, national government, and how much yung UHC budget, kung magkano yung nakukuha natin from the POGO operations.
Yes.
Please submit to the committee.
Yes po, Your Honor.
Okay, next, DF, BIR, may BIR ba? Wala, saan na? Okay na rin yun. Ay, BIR pala to, sorry.
Yes po. On behalf of the DOF and the BAR, Your Honor.
Okay, thank you. Thank you, I'm not wearing my port eye. Anyway, next, PAGCOR, who's going to speak for PAGCOR? Mr. Ramon Villaflor.
Good morning, Mr. Chairman. As mandated by law, PAGCOR's contribution to the national, 50% of PAGCOR's contribution to the national treasury goes to the universal health care. PAGCOR contributes 50% of its income to the national treasury. So the share of the universal health care from the gross income of PAGCOR is about 25%, Mr. Chairman. From the time that the universal health care was passed into law, PAGCOR has already contributed around the share of PAGCOR has reached about 46 billion, Mr. Chairman.
And likewise, I had a chance to talk to the chairman, Altenco, President ba? Altenco, no?
Yes, sir.
Then before he assumed, he committed that whatever is mandated by law, that PAGCOR's social fund will really be given to UHC. So please, I'd like to thank PAGCOR for that. Pero siguro kung meron din po kayong data on how much, please submit to the committee as well. Pati na rin po yung natanong ko na kay Attorney Ann Marquez, no, yung kasi mas diretso kayo sa Pogo, yung Pogo operations, no, 60% eh. Ang laki pala sa UHC, di ba? So, kaya nga ako, sana ako for gradual phase out kasi baka naman mabigla. Dahil 60% mawawala, malaki rin yun. No? So give us the data so that it can help us also in our decision regarding the fate of the POGOs.
What we have, Mr. Chairman, that 3 billion is only the regulatory fees collected by PAGCOR.
Doon sa POGO.
Yes, Mr. Chairman.
So if you would include the gross, di ba,
So,
percentage of gross, how much?
That is 2% of the gross.
The gross.
Gross gaming revenues of PAGCOR.
Meron ba kayo ng data in 2020 when it started, 2020, 21, 22, everything?
2017, no? We will submit, Mr.
Please
Chairman.
submit, no, para na makatulong because I think we will call for another hearing if necessary, if not with TW, kasi we would need those to appreciate, no, yung contribution.
Yes, Mr.
So yung 3 billion,
It's
sa
only
fees lang pala yun.
regulatory fees.
So how much
Chairman.
kaya kung isasama yung percentage?
For the taxes that are
Yeah.
paid, we don't have any data on that. It's the BIR who has data on the taxes.
The
paid.
BIR has the
Yes,
please,
Chairman.
siguro Attorney Ann Marquez, can you submit yung
Yes,
pong
sir.
gross, percentage of gross yan di ba? Tama? Supposedly, sa POGO operations.
We are not sure, Mr. Chairman, because there was a law passed.
Yes.
On the
According to the
taxation.
law na lang, please submit.
Mr. Chairman.
Yes, Your Honor. We'll submit also the total actual collections for the POGO operations. Thank you.
Okay, thank you very much, PAGCOR BIR. Next is PCSO, Chairman Juni Kua is here.
Thank you.
Thank you for coming, sir. Kahit na nandito kayo. Thank you very much.
Salamat, Chairman JV Ejercito. In the interest of time, let me abbreviate our presentation. Let me go direct to the contributions of PCSO thus far to the universal healthcare and what are expected of PCSO for the coming years. Thus far, PCSO has contributed 2.7 billion up to November of 2022. So if we add what is yet to be remitted, about 600 million plus, all told, on the average, every year we are contributing 1 billion to the program. What is expected for 2023 is, can you please move on? 2023, we expect to remit 1.2 B. You will note, Mr. Chairman, that the ability of PCSO to contribute to the program under the Universal Healthcare Program is the fact that we need to pay 20% of our receipts by way of documentary stamp tax. And this runs into tens of billions. So, ang na-advocate namin ngayon, Mr. Chairman, is that if we can be allowed by Congress to reduce our documentary stamp tax obligation, tataas yung aming contribution sa UHC. So, ang projection namin, kung 10% lang ang aming BST, ang aming magiging contribution ay abot ng 3.3 billion. At kung 5% lang, aabutin niya ng 4.4 billion. So, yun, Mr. Chairman, in a nutshell, is what PCSO can say and explain to this August committee, Mr. Chairman.
Thank you, Chairman Judy Kua, for your contributions also. The program, so we will study that also, pakisubmit na yung position, so that we'll study if we can legislate do sa document tax. Kasi yung 1.2 magiging 3 billion, so that's additional 2 billion for us, no? For
Yes.
the Universal Healthcare Act. No? So thank you
Yes.
very much for your presence, no? So next hearing, sana DMW, please be present. Mas magandang yung discussion if it's actual presence, no? Okay, next, lastly na, PhilHealth. Sa Sec Jerome, please next time please be present.
Yes, Your Honor. Mr. Chair, we will be present, Your Honor.
Yes, and please already we will please convey your yung proposal natin, no, to the secretary, at least kung, and also kung sa DMWs, kung yung ating officials and OFWs. I think this will be already this will be acceptable kasi kalahati na isa-subsidize na natin yung membership kasi PhilHealth needs also to get the funds para yung mga packages naman ma-roll out nila. Kasi kung wala sila makukuhang contribution, hindi naman nila mabibigay yung packages and claims. So, and it will, please help us sa information dissemination. Yung problema, hindi alam ng iba. See, I think if they will understand, lalo na yung mga packages na talagang lalaki, yung mga reimbursement, they will understand na may benefits pala. Kasi hindi mo rin masisi OFW, akala na nagbibigay sila na wala sila nakukuha. Well, actually meron, kaya lang hindi nila alam. So that's the responsibility of PhilHealth, of DOH, and DMW to inform our OFWs of the benefits. Okay? So next, last but not least, siguro PhilHealth, ano po ang masasabi ninyo unang-una doon sa ating adjusted rates schedule, no? Because of the situation, again, we have to adapt to the situation. So, kaya pa ba ng na ma-adjust yung ating pag-increase doon sa bago nating schedule? And what's acceptable to the agency?
Thank you, Mr. Chair. So, Mr. Chair, regarding the suspension on the premium contribution, wala po kaming, we don't feel that we create any problems, no? The cash position, the cash flow position, and the cash position of PhilHealth is very strong po. And we feel na makakaya naman siya po, no? Now, to give details po on where exactly we're going to be getting the funding po, I will ask Attorney Eli to make a very brief presentation po on where the funding will come from.
Yes, please, para we can understand also.
Yeah. Anyway,
where we can supplement it if needed.
Just for the information po of the good senator, honorable senator, no. Yung suspension of the 0.5 premium increase translates roughly around 17 billion po. No? So roughly 17 billion yan, and Attorney Eli will elaborate on where exactly we will get that from. No? Thank you po.
Yes, actually, that's what we want to hear, na para malaman natin kung ano kalaki and what services will be affected. Yeah, that's why if we need it, we will supplement na lang kung kailangan talaga.
Sorry.
Attorney Eli, sige po.
Yeah. Sorry, Your Honor, no? Before Attorney Eli starts, I just want to mention that no benefits will be affected. In fact, feeling ko, despite the suspension, baka either we will maintain the benefits, even improve the benefits. So, hindi po, wala pa naman nakikita na kaming problema po. No? Thank you po.
Attorney Eli, sige po.
Mr. Chairperson, we have a presentation for about 3 slides. Okay. As provided under Section 10 of RA 11223, the premium rate for calendar year 2022 shall be at 4% with an income floor of 10,000 pesos and a ceiling of 80,000. This translates to a monthly contribution of 400 pesos up to 3,200 pesos. This equates to an annual contribution of 4,800 to 38,400. This is carried over in 2023 upon the directive of Malacanang. In PhilHealth's original projections, the corporation was anticipating 2023 collections at 147 billion. Considering the deferment in both the rate and income ceiling and therefore retention of 2022 rates, PhilHealth now projects collections by year-end at 130 billion. This translates to at least 17 billion in potential collection loss. Hence, the challenge is to cover this 17 billion projected loss. PhilHealth will be able to cover this by implementing the following strategies. Next slide, please. In view of the suspension, PhilHealth intends to intensify its marketing and collection efforts and employ the following. 1. Intensify mapping and compliance monitoring of employers, specifically micro-employers, businesses, and the tagging of closed businesses through the newly hired PhilHealth Accounts Management Information Specialist. This would increase remittance rates of direct contributor accounts. 2. Secure the local government units the list number of businesses who applied or renewed their business permits as inputs to the attainment of operational targets. Initiate data sharing agreement with LGUs and national government agencies with automated issuance of professional or business permit or license processes. Tagging of NHIP members who do not have the capacity to pay premiums in coordination with the LGU and Social Welfare and Development Office. 3. Adoption by the PhilHealth regional offices on accounts management monitoring tool, the innovations developed by some PhilHealth offices in the interim. 4. Promotion of the Philippine Business Hub initiated on the registration of new employers into the program and monitoring its operation. Promotion of online payments to self-earning direct contributors, including migrant workers. 6. Intensify information, education, and communication of the program benefits through the Quad Media and Alaga Ka community-based activities targeting self-earning individuals and migrant workers. 7. Strengthen linkages with local government units, civil society organizations, community-based or sectoral organizations, as well as national government institutions the conduct of IEC activities. 8. Implementation of statement of premium account for self-employed direct contributors, including migrant workers. 9. Full functionality of the registration, amendment, and member verification modules of the PhilHealth member portal. And develop a policy to tap community-based volunteer health workers and barangay officials, if necessary, member recruitment, premium collection, and similar activities, and to grant such workers incentives. With these initiatives, PhilHealth intends to make up the potential 17 billion gap brought about by the suspension of the premium increase. In addition, as reiterated in our recent official statement, we assure the public that the current benefits being enjoyed by members will not be affected by the said suspension. We also reiterate that PhilHealth's financial standing remains strong. The management is confident that notwithstanding the suspension of the increase in premium rates, PhilHealth is more than able to meet its financial obligations, its members, and partner healthcare providers. Next slide, please. As for the proposed UHC amendments, particularly on premium contributions, we welcome the changes, especially as these are meant to provide financial relief for our countrymen. On the other hand, in our intention to also advance the goals of UHC, we're also reviewing and will be submitting our proposed enhanced premium contribution schedule. We hope to strike a balance by capturing the plight of all Filipinos as we continue to recover from the pandemic, and at the same time manage a more inclusive, responsive, and more importantly, a more sustainable national health insurance program. Thank you, Mr. Chairperson, and the board members of the community.
Thank you, Attorney Eli. Anyway, you have copies already of the proposed amendment. And siguro the other agencies can also submit their positions. No? Anyway, yung sa affiliate contribution, if you can flash it. Meron ba tayo? Meron ba tayo? Ito. Mas madali sana para at least meron tayong wala ba tayo dala? Anyway, yung dati, 4% 2022, di ba? By 2022, 2023, 4.5% na supposedly at this time based on the UHC law. Income floor, 10,000. Income ceiling is 80,000, 90,000, 100,000. Kaya medyo malaki yung monthly contribution. Minimum 400, 3,200 maximum. Pero dito sa ating bagong bill, for example, for 2023, doon sa UHC law, 4.5% ang premium rate, income floor of 10,000, income ceiling of 90,000, and yung premium monthly contribution, minimum 450, maximum of 4,050. Supposedly, ito yung pre-pandemic rates that we included in the UHC law. But in the Senate bill that we are proposing, like for example, in 2023, yung premium rate will be 3.5%, income floor 10,000, yung income ceiling yung bago no? From 80,000, 90,000, ngayon ginawa na natin 40,000 for the next 3 years. Okay? So ang maging premium monthly contribution will now be only 350 minimum and maximum 1,400. So I think that's a big difference. Kaya nga po, yung mga OFWs, no, if they're listening, ang ano lang, baka 500 na lang po kanilang contribution monthly. Diba? Minimum. So yan po. Yan, lakihan na lang yung, yan, para for the appreciation of everybody. Kaya bang yan, no? So you feel health, do you what's Attorney Eli or Press Money, you have anything to say kung okay sa inyo tong bagong adjustment natin? Again, this is to adapt to the situation para magkaroon ng chance maka-recover yung ating mga workers.
Mr. Chairperson, if I may, Mr. Chairperson, we support the measure, Mr. Chairperson, as to the effect these our actuarial projections for the next years, Mr. Chairperson, we will provide the committee that projections, Mr. Chairperson, and our position, a formal position on this, Mr. Chairperson, please. Thank you very much, sir.
And then for the understanding of everyone, yung pong premium rate hike every year nagtataas no? 3%, ayun na po, yun yung siguro, baba natin para may comparison. Meron dyan, yung premium rate hike, 3.5, 4%. Attorney Ila, is this based on actuarial projections? Kaya every year talagang kailangan tumaas yung pong premium rate hike. Hindi ba pwedeng fix na lang?
Mr. Chairperson, when I'm sure our chairperson knows this perfectly, when we crafted the Universal Healthcare Law, we base it on actuarial projections. That's why, Mr. Chairperson, the benefit rollout of PhilHealth is based on the premium, is somehow based on the premium increase. Despite that, Mr. Chairperson, we reiterate our support to this measure. And again, PhilHealth will adjust through the leadership of our PCO, Sir Mandy Ledesma. We will adjust, Mr. Chairperson, and with this, we will provide an actuarial projection with respect to this data, Mr. Chairperson, please.
Well, thank you for that. Anyway, it's very clear on the screen right now, no? Malaki na po na pagbago, and I think PhilHealth already accepts na kaya naman na to, despite the change in the projections and the schedule of the rate increases. Kaya naman po.
Yeah. Mr. Chair, kaya naman po, kakayanin naman namin po, no? If you look at kasi the review, very strong yung cash position ng PhilHealth, no? Through the years. And currently, it's close to, it's around, at around 370, 380 billion. So with that, there's really a lot of leeway po naman, no? It can be absorbed. Whatever the new terms can be absorbed by PhilHealth. So I guess maybe for the near term, for the short term, walang problema po. Then I was also thinking, we just passed an extraordinary 2 years with COVID, and yet the financial position has continued to remain strong po. So, again, we just want to reiterate, like what the CEO Attorney Eli said, no, kakayanin po ng PhilHealth. Hindi po problema ito. Thank you po.
Anyway, as also sigurong one of the proposed in amendments, no, that in case yung tulad ng nangyari sa atin, yung pandemic, nobody foresaw that. No, it's a health crisis. So in case there will be another health crisis, we will give the president the power probably to suspend increases siguro, kung okay lang yun. Because we never know, it will happen again. Kailangan na again, we have to adapt to the situation. Sige po.
Again po, like what I mentioned earlier, despite although extraordinary times yun yung 2 years na COVID, yet the financial position of PhilHealth continued to be okay. So, without that, and even with this new...
Despite the PhilHealth covering most of the COVID cases, di ba? Marami.
Exactly po. Exactly.
Milyon, umabot na ng milyon, di ba?
Yes.
Baka hindi alam na iba, nakakover yan because of UHC, right?
Yes po. So with that po, at for now, diba, with regards to the new terms, the new increases or decreases, kakayanin talaga po ng PhilHealth. It won't be a problem for us, at least for now po.
Thank you, Press Money, and that it's good to know that PhilHealth will be able to survive. Kakayanin, no, natin ito, no. And the last thing we want to do also is to be a burden to our people, no? Ang gusto nga natin quality of life, kaya nga the access to good quality healthcare is our target. So hindi naman natin gusto i-burden. But of course, then again, also we need to get contributions para nga ma-roll out to, di ba, ang program natin. But malaki na po yung difference, no? See, from supposedly 2023, 4,050 na yung maximum. Magiging 1,400 na lang. Because we increase also, we decreased. Ginawa natin fix yung income ceiling for the next 3 years. So, I think this is a more acceptable. Sayang na wala si DMW dito eh. If they can see this already, tsaka yung other it's a big change already. Medyo magaan-gaan na ito para sa lahat. Okay? So, with that, again, thank you very much. The chair would just like, I expect your position papers, yung formally, please submit. Again, thank you very much. It has been a very productive first hearing on the proposed amendments. So we will have a TWG. Kung if needed, another second hearing. Kung hindi man, probably we will already, para naman tayo nagkakasundo na eh, no? I think all of the agencies are in support of the proposed amendments to the Universal Healthcare Act, especially on contributions. Ang crucial na lang yung DMW kasi marami silang mga points that they want to raise, but hopefully magiging na to. Ang proposal natin is for OFW special case that we will subsidize. Government will subsidize. We will put, siguro take note na lang ng DBM that we will allot budget for the subsidy OFWs, yung kalahati. Kung okay sa PhilHealth yun, at least meron pa rin kayo makuha, but it will be subsidized siguro sa GA. Well, that's our initial proposal. I'm hoping siguro maging acceptable at mababa na rin yung rates eh. Diba? Doon sa proposed new premium contributions. Okay? So with that, I'd like to thank everybody. Thank you very much. Supposedly working lunch, nandiyan na yung lunch niyo po, pwede na yung kumain. So thank you very much for those agencies who have not submitted the position papers, please submit for the committees, perusal, submit to the secretariat. So okay. For the information, everyone, we will refer the bills considered today to the technical working group for further study and consideration. Okay, so with that, again, this hearing is hereby adjourned. Thank you very much for your time and for your contributions. Maraming salamat.